Check, check, check. A very good morning to one and all present here. It's not the years in your life that count, it's a life in your years, says Abraham Lincoln. This powerful thought beautifully captures the essence of why we all gathered here today. Today, science is not just asking how long we can live, but how well we can live.
And the answer to that question lies deep within biochemistry, in our cells, molecules, and pathways that shape the process of aging.
It gives me immense pleasure to welcome all our respected dignitaries, eminent speakers, faculty members, and our lovely students to our Saveetha Anti-Aging Biochemistry Conference, SAAGECON-2026. I am Amara Farhan.
And I am Tenin.
And we will be the host for your day.
So, without any further ado, let's begin with the first session of the day.
Right. Aging is not simply the passage of time, but the gradual changes occurring within our cells. Our first session by Dr. Sriram Mahadevan sir explores this beautifully through the relationship between muscle and bone. To introduce the chairperson for this session, I now call upon Ms. Aarti.
Respected dignitaries on and off the dais, esteemed faculty members, and dear students, a very warm welcome to everyone present here. I am Aarti, final year postgraduate student from the Department of Biochemistry. It is my privilege to introduce the chairperson for this session, Dr. B. Shanti, MD, an accomplished academician and distinguished leader in the field of biochemistry. Ma'am serves as a professor and the Department of Biochemistry at Sri Balaji Medical College and Hospital. She completed her MBBS from Keel Park Medical College and pursued her MD from Madras Medical College. Her professional journey reflects consistent growth and commitment. She has served as a resident medical officer at Durgabai Charitable Trust Group from 1992 to 2000. Ma'am has a vast teaching experience of 25 years. Her areas of expertise include educational leadership, laboratory quality assurance. She has played a key role as Deputy Lab Director for ISO NABL accreditation. Beyond academics, ma'am has held several important responsibilities including Chief Warden, Institutional Ethics Committee Member and Secretary, Director and Mentor for 9 PhD scholars, and Assessor for UG, PG and Allied Health Science students. She is also a life member of Indian Medical Association and the Association of Medical Biochemists of India. With this brief overview of a distinguished career, I welcome Dr. Shanti ma'am to the stage. Thank you.
Very good morning to everybody, and first of all let me congratulate the Department of Biochemistry headed by my very close friend Dr. Anandi for having hosted a very important technical topic of the year, aging, and long way to go. Very good. Congratulations to Department of Biochemistry. Now I am highly privileged to introduce the first speaker of the day, Dr. Sriram Mahadevan, who is currently the Professor Head, Department of Endocrinology, Diabetes and Metabolism at Sri Ramchandra Medical College. And he is undergraduate, he has undergone his undergraduate from prestigious Stanley Medical College, post-graduation from PGI Chandigarh, and DM also from prestigious institution of PGI Chandigarh. And he is, for 2 credits, published more than 125 articles in peer-reviewed journals, and he has got to his credit 20 chapters in textbooks of endocrinology, diabetes, and medicine. And practical investigation of several drug trials on which he has been the principal investigator. And awards, to add to the awards, he is an honorary national professor by the Indian Medical Association, College of General Practitioners. And inspiring endocrinologist, which was quoted by Economic Times in June 2023. And he has got a Selvi Saraswati Endowment Oration, Department of Endocrinology, University of Madras, January 2025. And he has got very, very prestigious positions, formerly Vice President and Finance Secretary of Endocrine Society of Tamil Nadu and Puducherry. And he is also the executive committee member of Indian Society of Bone and Mineral Research. And special interest includes thyroid, metabolic and gonadal disorders. And from most of our biochemistry departments, we have been participating in various conferences organized by Dr. Sriram Mahadevan, and he has been encouraging, as an organizing secretary, encouraging the budding research scholars and giving them various like concessions towards presentation. And our college has most benefited by some of the conferences organized by Dr. Sriram Mahadevan, sir. Thank you, sir. And over to the podium, sir.
How do I see the slides? Angiya? Okay, but we can't have it here. Vanakkam. Good morning to everybody. I think I am audible. Somehow I am not hearing my voice. Anyway. I am told this is hybrid conference. Should I face any camera or something for me to be seen? Oh, Durkar. Sorry. See, this is how we miss obvious things, sometimes. Anyway, this is a wonderful hall. Thanks to Dr. Anandi Madam and everybody in the team of Saveetha Medical College, Biochemistry Department, and as well as I'm sure the management, Dr. Kannan, I think he's the principal now, I'm vice principal, yeah, and several others. Saveetha, I'm it's a great pleasure to be here today morning. I in fact preponed my talk to the first session for some other assignments I have after 11. Thanks to Madam for accommodating. And this conference itself gives a lot of philosophical thoughts to me, more than biochemical or endocrinological or metabolic. It is and when I say philosophical, I'm given 40 minutes at least. See, I have this bad habit of sometimes exceeding, Even if it is 40 minutes or 1 hour, I can be going on. We have endocrinologists are sometimes, long-acting hormones. We will be, so please stop me when it is boring, or anytime you can interrupt. Let this be highly interactive in that word, because it's already a crosstalk between muscle and bone. So between Sriram and our ex or all the audience here, I'm sure you will be knowing many things more. Just because I revised recently, I may put some slides to read out few things. Frankly, that's the thing. But the experience which we gained over the last 3 decades in several aspects of metabolism and other things, we can share. That's what is the idea of these kind of meetings, and I really wish how many of you are postgraduates here in the field of biochemistry or medicine? Or I was told that the Saveetha, I think, most of postgraduates are standing. You can, there are so many seats there. All others are UGs, sir. I mean, the audience is a mix of and practitioners, sir. Nobody, no. Anyway, just to have an outlook, so that some questions which I may be posing to, it is better for UGs to be posed with some questions. Once we become professors in colleges, we have this uncanny habit of asking questions also, no? Not us. Online, online connect. They can always type the questions, and if we know the answer, we will share. Anyway, very nice to. Why I said it's philosophical is, first of all, if you see aging, the word aging or whatever you go into it, at least superficially, our understanding from our culture, from our way of how we have been taught about this, it's a natural process. Anything natural can be called physiological. Then how can it be, there can be something anti to it? It is unwritten rule, whether you accept it or not, it is the hard fact of life that anything which is born has to die. Something is formed, it has to get destroyed. There is nothing called reversal. And I don't want to go into the spiritual or philosophical aspects. There are certain unperishable or totally always persisting things. You can call it by any name you want. So unless you become that, you have to age. You can call it aging, or you have to end somewhere. So the cells also die, no? While walking towards the restroom, I saw towards that was physiology department, necroptosis, the pathway of necrosis, apoptosis. So many things are written. So how can those things be wrong? You can go molecular, you can go at the macro level or micro level. At the end of the day, anything which is formed has to somewhere gone. So I personally feel the word anti-aging can be reframed into something. People can look into it. And more interestingly, the SAAGECON, the sergeant correct Dr. Deepak. Interesting. Anyway, our sages were probably had the clue to anti-aging rather than we. Because most of them have, see, it will be intriguing just because, before we go further, let us accept one fact that just because we don't know something, we should not say it is not there. Few hundred years back, nobody would have accepted a bacteria or virus. Today, everything we know about, how we can demonstrate all these things. Same way, there were some things in our literature or in our past, our people who were, you can call them sages, you can call them today's scientists. They had some clues behind how to enhance life, prolong life, whatever that form be, but in happy manner. Today, we are prolonging life by quantitatively, many times not quantitatively. You go to any ICU, you go to any chronic disease. I am part of the chronic disease maintenance department. We can call that way. We don't cure, no? Most of the chronic diseases are not cured in that sense. Anyway, so one important aspect of aging is our locomotor system, which we all grossly make this into a unit of musculoskeletal. How do I change the slides? Do we have from here? Yeah, that's okay. Slideshow on. Idhula aguma? Oh, anga ponuma? Idhula agada? Yeah, that's okay. See, these are all standard things. Please don't take photos on if somebody is taking it. Nowadays, in every meeting, everybody is showing their. All these are in public domain. You all know that we have this. நான் கொஞ்சம் ஆப்பிள் கம்ப்யூட்டரை யாரோ வாங்கி கொடுத்துட்டான்னு ஒரு 4 வருஷமா அதை யூஸ் பண்ணுறேன். ஸோ command C, command V instead of saying control C. That's all the difference. Otherwise, we all copy paste from many things. But inculcating or taking the concepts inside, reflecting upon it, discussing loudly, getting thorough with the concept is more important than actually superficially reading out. Reading out all my slides will take less than 20 minutes. But I will spend few minutes slightly differently to tell things which I felt would be appropriate. Many times these slides, when you read out, it looks very easy. Low bone mass, quantitatively or qualitatively, part of aging, which makes that person at an increased propensity to have fracture, is called osteoporosis. Is the broad definition. But, நானே கஷ்டப்பட்டு டைப் படித்தேன். அங்கே யாரோ பண்ணுறா அந்த இது அனோட்டேட். சம் சைல்டு இஸ் பிளேயிங் வித் தட். The Zoom is a problem. Unless you block all the other people's annotate that segment, you will have this. Anyway, and see, just like I had a few gray hairs even during my MBBS time, 23, 24 years. So that means there is something happening there. Skin wrinkling can happen. Bones are, there is a natural way in which all these go to a peak level of that's health, pink of health you can call it. Then there is a gradual decline. Endocrine system beautifully explains all this. We can go on, and we are going to discuss in the next 30 minutes as to how our bone and muscle are undergoing these processes. நம்ம ஊர்லலாம் சாதாரணமாக பெரியவங்களுக்கே தெரியும், எல்லாம் வயசாயிடுச்சு, இனிமேல் கொஞ்சம் கஷ்டம்தான், இந்த கூன் விழுந்துருது, குச்சி வைக்கிறது. Anyway, the field of study of elderly people is called what? UGs? That is from a Sanskrit word. Do you know that? Jara. Jara means to age. Jara linda geriatrics. Similarly, I was wondering, bharama irukna enna artham? Weight adhikama irukundha artham. Bariatrics adlendana varudhu. Just think about this. Anyway, it is not rocket science to understand if you know basic embryology, basic anatomy. This is very interesting. I don't know why we don't consider muscle and bone as one unit. When you discuss in pediatrics or in obstetrics, we are feto-maternal unit. They are one unit when you discuss in obstetrics. There are many things we have to consider together. And the mari, muscle and bone has to be taught together generally, at least while discussing physiology and function and these kind of age-related changes. However, we don't discuss it that way. Why? Any guesses? You will see, just now Kannan sir told me that they are planning to have one obesity-related discussion next month or so. Why suddenly obesity? Why not last year? Why not 3 years back? Why so much of discussion on obesity in the last 1 year, especially in India? I am happy to see very few like me are on the overweight category. Most of you are quite okay to at least appearance-wise. Any guesses? I am going to give one harsh truth of life as well as medicine is, see, when you get a new pharmacological molecule for a particular condition, then that condition is talked about more. Obviously, to popularize the molecule. In the name of the pharmacological agent, we also learn about the disease. The other way around was there once upon a time, like, sometimes celebrities get disease, then the disease becomes more popular. Any name? There is one very devastating neurological condition called amyotrophic lateral sclerosis. I'm sure all of you know. It was in 1900s early when one great basketball player from US, it's otherwise called Lou Gehrig's disease, from the basketball player, Gehrig, G-H-R-I-G. Anyway, that fellow got the disease, so it became more popular. Then lot of money was pumped into what is the pathophysiology, what happens, etc. Same way, you'll be surprised to know one of our endocrine diseases, Addison's disease, you all know. Today it's left and right, you know what to do with, we know the exact pathophysiology and all quite well. And hydrocortisone is now easily available both as injectable and tablet. This hydrocortisone was not available before 1960s. You'll be surprised. It was discovered in 1948. Nobel Prize was given to steroids. I don't know whether you are aware of this. Mainly because steroids were not only physiological, but they were first time demonstrated to have an anti-inflammatory effect, and rheumatoid arthritis got better. So 1948 Nobel Prize was for steroids. But hydrocort was not in a big way for Addison and other things were not available. Then this famous, the president of USA, he had the problem. Which president you know? Kennedy. You should go and read about Kennedy and his family. Everybody had all endocrine disease possible. They had all autoimmune conditions. Kennedy had Addison. His sister had both Graves and Addison, vitiligo, Addison, everybody. And that the president of US, even today, we will not go into controversies. They are the first people of the world. So anything happens to the president will be world, flashing news. So they always used to carry, they produce more cortisone to keep always ready. If he crashes somewhere, if he does somewhere. Unfortunately, he was shot dead. But otherwise, they used to take cartons of cortisone along with him whenever he goes there. So production of cortisone increased. I sincerely request. So why we are talking about obesity more is because till recently we had pharmacological agents which were very, very averagely effective, not dramatic. See, paracetamol, you give for fever, the fever comes down. We know it will come down. Predictably, it will come down most often. If it doesn't come down, then we condense and we and all discuss in our wardrooms. If paracetamol respond the fever, that's the exception. But generally, we know it was. You give a diclofenac, the pain will come down. 90% of the time, at least most of the common pain problems. Same way, had there been a molecule like that for obesity, maybe that molecule by now, most likely Nobel Prize could have the way they are going behind these new molecules. The hormones which are now available for obesity treatment, all of you know that, very famous. They are more famous in non-doctor field. All dietitian group, all the physio, what do you call that? The studio, the exercise, the lifestyle modifiers, what are they called? No? Influencers, wellness clinics, they are all prescribing. You all know Ozempic, you all know Mounjaro. How many of you don't know? Very few will know. Today it's very popular. It's all, you go to the airport, there is a big thing saying. So, allopathic branch of our medicine, unfortunately, to some extent, has gone behind any molecule as a treatment for a disease with proven efficacy. If it is discovered by beautiful research, we cannot underestimate what they have done. Unless that is popularized, we don't discuss the disease itself sometimes. Or it should be a real devastating thing, like corona. Corona was killing everybody in a big way. So, you know how much within 1 year, how many papers came out of it, how many vaccines came out, etc. So, either it should be a serious global problem, or it should be a problem where there is a vitamin M component to all of this. And today we discuss muscle, and mainly behind muscles, to be very frank with you, which we didn't discuss for 30-40 years, is we are now coming up with some molecules. Let me give you a prelude before going further into the physiology and aging related thing. Same way osteoporosis. Osteoporosis till 1990s, as you know, you ask any orthopedician, they will not even diagnose osteoporosis. 1992 only we brought in a method. See, what cannot be measured cannot be monitored or managed. This is the, so anything can be quantified. Biochemists are here, so I will not go further. You all know how we have to measure something. Unless you measure something, you cannot manage or you cannot monitor. So once you started developing technology to measure bone, the density or something, then you got the idea of, why can't we intervene, what are all the factors. Now, otherwise bone would have been just discussed like in histology section, Herbacean canal, there is one, all the osteocytes, this and that. We wouldn't have discussed this. Slightly negative statements I made, but that is how science grows. I wish the real research-oriented people here will take up. Sometimes these molecules are wonder molecules, like the obesity-related thing which is coming up now. Today in the field of cancer, you all know that these kind of molecular research only has led to almost cure. Now we are curing many cancers. I'm sorry to say that as a diabetes-oriented person, I don't cure diabetes, but cancers are getting cured. I can name offhand at least 5 cancers through my friends. We all know it is now curable. They have it. You can just say that in the next 1 year, you will most likely be without the disease. The fear might the psychological aspects are different. Like chronic myeloid leukemia. Today we have an oral drug. Most often they are cured. Adhe mari diabetes ko earlier. That question is asked by all patients to me. So I am putting forward loudly, thinking along with you. As I said, I am as good as you in many of these subjects. Idu enna pannanum? Inge ponum. Thambi edavadhu maatrennaru. So we were discussing osteoporosis in a big way in the last 2 decades, defining, quantifying, using technologies, different. The most agreed technology by WHO definition is DEXA scan. You all know that it is an X-ray based method of estimating bone. And whenever we discuss bone, without DEXA, without CT, MRI and all, you can't go. But we should know that these two are a unit. That's now we discussed. Muscle and bone, both anatomically also they are connected. We all know how the bone, in every part of the bone you have an insertion of the muscle in the form of a tendon. Anatomically they are close to each other. No refutal of any of these facts. So obviously there is a relation. Secondly, embryologically also they are from the same layer of the trilayered, the mesoderm layer. Then that mesoderm, somatopleuric, splanchnopluric mesoderm. In the somatopleuric we have the myotome, and from that myotome you have this. You can go on and on. Once you go into it, you can explain it in a big way. So basically, origin is also same, anatomically also close. There is no refutal of this fact that there is a very close connection. And when gross physical connections are there, obviously there will be molecular and other level also interaction. And by even gross clinical observation, we know that the health of the bone is directly, many times indirectly related to muscle. For example, somebody has a stroke. one side of the body, whichever, let us take left MCA. So the right lower limb is not working for the next few weeks till physio. Why do we do physio? The aggressive physiotherapy brings back the. So that means if you see the X-ray of that person who has not used the limb for even 2 months, 6 weeks, you will see a gross difference in the bone. There will disuse atrophy of not only the muscle, the disuse atrophy of the bone also. That atrophy we call it actually osteoporosis related to immobilization. Immobilization related osteoporosis. That's why you see orthopedicians are very, very aggressive behind somehow making the patient walk or ambulant as early as possible. 20 years back, 30 years back, hip fracture in a old lady, they will say rest, adu thana heal another undu, fracture nama pota risk aidum. 90-year-old also, they will somehow within the next 3-4 days after medical fitness, they will. That is because once she starts moving only, the bone also will heal, muscle also will pick up. Otherwise, your health will become even more bad. So we all understand from our simple observation that muscle has to be always moving, muscle has to be alive and moving, then only other health is maintained. எங்கள் பாட்டி my grandfather was very frail and இப்போ பேசுகிறதெல்லாம் அவருக்கு தான் இப்படியே கூணலாம் இப்படியே ஓரமாக படுத்துக்கிட்டு உடம்பு கை காலெலாம் அசைங்கும் நீங்கள் அசைக்கலைன்னா அப்படியே போயிடும் உடம்பு அதே யூசி இந்த காலையில் எழுந்தோடனே எதாவது 2 வாட்டி கை காலெலாம் அசைக்கணும் எதாவது பண்ணணும் சும்மா உட்காண்டே இருக்கக்கூடாது. திஸ் யூஸ் டு பி அவர் வே ஆஃப் telling people, anybody who is lazy sitting, they'll say, நடந்துட்டாது வாங்க சும்மாவது வெளில போயிட்டு வாங்க. Otherwise you will have, this is well known, no? That means there is a, it is not, இன்னைக்கு நம்ம நிறைய மாலிகுலர்லாம் பார்க்க போகிறோம், but imagine this is all clinical observationலே தெரியும். Today we have come up with some interesting discussions at a subcellular level, that's a different story altogether. So there is no taking away from the fact that, so as I said, we have this excellent instrument, standardized. You will be surprised to know, but WHO reference it's very good. Whenever, I really wish the postgraduates and the UGs listening to these kind of talks from next time, such definitions are given, etc. On one side, for exam purpose or for research purpose or something, you have to memorize, you have to learn some things, what are the cutoffs, etc. However, more important is to learn how they derived this. Who said it is 2.5? அது கேட்கணும். கேட்டால் இப்போ அதுக்கே நான் ஒரு 20 minutes spend பண்ணுவேன். But just to tell you that unless you ask that question, you won't know that this number can be changed by somebody tomorrow. Already changed. Anyway, this is for a long time, so I'm putting this here. So I'm giving you the thought process behind. See, they had the thought process 3-4 decades back to come up with something like this. This is something better than nothing principle. 1992 or 90 in Moscow, they sat together, few people like you and me, and they said that this instrument is available which is able to quantify bone in less radiation. It's not an X-ray, it is much, much lesser than X-ray. It is much lesser than even a mammogram. That's how they will say. DEXA scan, even though it's an X-ray based technology, the radiation is very, very low. And they will compare it with a younger adult, like a 30-year-old woman, to compare a 60-year-old woman's bone against this. Why do we do that? Any guesses? Why should we guess? We don't diagnose diabetes like that, no? I will check glucose of a 70-year-old lady, compare it with a 30-year-old lady, and then say that this glucose is this much deviating from this. We don't do that for diabetes. We don't do that for blood pressure. Why do we do this for bone? A similar thing will come up with muscle also, is what I presume. It should be actually done. You see, whenever that parameter has a tendency to go down naturally or go up or whatever, alter with age, then you should know what is the peak at which this T-score, which is in a standard deviation score in comparison with a younger female, is because you have to account for the natural decline in bone density. The Z-score is comparing with the same age group. A Z-score 70-year-old will be compared against age and sex match 70-year-old. But T-score is compared with younger age because you have to account for the decline which happens naturally with age. Otherwise, every time a 70-year-old will be definitely lesser than that. How can 70-year-old's bone be as good as a 30-year-old? This is common sense. But how much is it deviating? Whether it is within limits. That is why we take natural, normative values of 30 to 40, 40 to 50, 50 to 60 like that. Now Indian data is available. ICMR has done a beautiful project. 2010 itself it is published. So now, unfortunately, the machines are Western. So the machine, this is software based. We can manually calculate the Indian bone density versus Western bone density. What you get in the routine machine is actually, I think our hospital has bone density. No, you go now, if you are interested, you will see that it will be Lunara, Hologica, whichever machine is there. There are only two major machines, and they will be Caucasian women data only, which is Western data. But Indian data is there. But you see what audacity those fellows have. We have discussed so many times with them. They don't put the Indian information inside. But you can calculate if you want. It's a simple app is also available now. So just to tell you, osteoporosis is defined like this. In osteoporosis, even though it is defined based on bone density, actually what you see in heart problem, suppose you do an echo. Echo is a structural imaging with some functionality. Nuclear scan of the heart test will give you some function of the heart in a better way. But ideal way to check the heart is to stress. You know that stress test they do? During stress, what happens to the blood flow can be indirectly picked up by the muscle moving or not, blood flow is there or not, or rhythm problems by another. See, you see how many components of the heart you can study by different kinds. But ultimately, anything functional is better than structural. This is, endocrinology, the gland can be small, or somebody can be short or tall, but whether they do their work is important. And the Mari, bone, if you want to really define osteoporosis, you should see the function of the bone. You should stress the bone and see whether it is cracking at that stress. But you can't do it. You can't, just like stressing the heart, we can't stress the bone. But in animal studies, you know how they do the animal studies on this. They will remove the vertebra after sacrificing the animal. They will crush it. The pressure required to crush can be defined. But that's not possible. We are using all these indirect methods of bone density. So ultimately, what should define osteoporosis is the strength of the bone, not just the density of the bone. Sometimes a glass piece kept somewhere will appear thick, opaque, pata stronger, pota takunu odanjirum. Bone la nariya vaati appadidhaan. All the sclerotic bone disease like Paget disease, you have a number of other diseases, all the bone will be weak. They will appear strong. X-ray la pata apdiye tube light mari irukum, white bone weak irukum. Ultimately, we don't want a false impression created by density, but we have no other way of measuring. However, muscle gives us the opportunity not only to check the bulk of the muscle or mass of the muscle, you can also check the function. So please, this is now becoming a big research area now. So many PGs are doing theses everywhere because simple techniques are that. You see here, you can not only measure the muscle, a simple inch tape will give you the circumference, you can see, you can take a photo, you can do an ultrasound, and you can check the function of the muscle against resistance, how much pressure you generated, which muscle group. So muscle and osteoporosis, sarcopenia, the word we use for muscle, is not as simple as muscle density alone going low. You can use functional definition also, and it is more relevant to use functional definition. So that is why we are slowly coming up with a lot of consensus of age and aging and all. You see here they have nicely tried to define sarcopenia based on an initial questionnaire. That questionnaire, if you can go through, it will give you a few simple questions. Then you have this grip strength. I'm sure your physiology and other department, everybody, they'll have hand grip. Adli standard is how much pressure you can generate. Simple, sitting and getting up. Walking for 6 minutes, how much time you take. All these are simple tests. And based on that, you can immediately come to a simple conclusion. So, okay, this patient is for probable sarcopenia or not. Then you can use any technology, whichever is. See, this is a problem. Private institutes like us, many times the cost is a big factor. So DEXA scan is again standard for muscle also, body composition also. However, DEXA scan for body composition purpose is pretty costly. We are not able to do it. So, but for research purpose, they are doing it in other centers. You can do sarcopenia based studies by functional studies. And we define sarcopenia based on this. So, just to give you an idea, we are now able to understand that both these muscle and bone are very closely intertwined structurally, anatomically, and also functionally. And now in the next few slides, we are going to just throw a few points on At cellular level also, there is quite, obviously there has to be an interaction, otherwise how will you see the macro? At micro level, there seems to be a very close interaction. We will go through some of this. This is very oversimplified first statement. We all know that any lack of movement of the muscle leads to atrophy, which we have seen. And regular movement of the muscle in the form of exercise, and that too against resistance, definitely causes muscle hypertrophy. இங்க இடத்துல நம்பர்னு போட்டிருக்காங்க, அது வந்து decline in number. But yes, generally it is hypertrophy. And to maintain the health of the muscle and bone, we not only require exercise, we require nutrition. We all know that. In nutrition today it's எல்லாரும் protein இப்போ பயங்கர hype on protein, no? Anyway, we will go into the, I am sure there will be questions. I am opening up some questions and giving some provoking statements to make you think more. Then comes these kind of, இதெல்லாம் தான் வந்து எக்ஸாமில் எழுதுறதுக்கு நல்லா இருக்கும். மயோகைன்ஸ், நாங்கள் இப்படி தான் ஒரு 20 வருஷம் முன்னாடி என்னோட டிஎம் எக்ஸாம் போது அடிப்போகைன்ஸ், அடிப்போசைட் ஆஸ் அன் எண்டோக்ரைன் ஆர்கன், இப்போ நாங்கள் வந்து மசில் ஆஸ் அன் எண்டோக்ரைன் ஆர்கன் கொடுப்போம். இன்ட்ரெஸ்டிங் டு, அந்த மாதிரி சொன்னால் தான் அதை நீங்கள் பற்றி திங்க் பண்ணுவோம். Intestine as an endocrine organ was my physiology first year essay question. Gut hormones, GI hormones ன்னு கேட்டுட்டே இருப்பாங்க. இன்னைக்கு all those hormones are coming as therapy. அப்படியே ஒரு 25, we used to go to some bigger physiology books, there they'll give a lot of names. cholecystokinin, oxyntomodulin, என்னெல்லாமெல்லாம் வரும், நிறைய பேர் இருக்கும். அப்போ தான் அந்த கிளிசன்டின், அந்த அதில் வந்தது தான் இப்போ எல்லாம் ஒன்று has become one molecule now. To understand, so all those were discovered in 1960s. As I said, unless that basic physiological studies done by those great scientists in 60s, till a molecule came, they were all in the oblivion. Nobody knew what they were. Today, once you have a therapeutic intervention, everything will be dug up. No, 60s le theriyum the concept, ipada vanduchu. Same way, there are two important pathways, like in this WNT beta catenin. Somebody will know all this, no? Something you have heard of this. Basically, these are the WNT pathway and the beta catenin are anabolic pathways generally in bone and muscle. Anabolic, they help in the growth. As you can see, it helps in osteogenesis, it can help in myogenesis. Then the other side, this rank and rank ligand pathway, they are on the osteoclastic side, which means catabolic pathway. See, anything to be maintained in homeostasis, there should be equilibrium maintained between anabolism and catabolism. That's why this, our normal, I'm sure I need not tell to the biochemistry audience, you have all these reversible reactions maintained at a particular rendu pakkam. It is very, very interesting to know that even in nature, many things, to create something you need both the positive and negative. All the 7 colors together only give the white color. Same way, you will be surprised to know that the color printout machines you have seen, in a color printout machine, if you take a black and white picture printout, you know how it does. There won't be separate black and white color in the color printout machine. Color kirkum, it will mix the appropriate colors to make black and white. அந்த மாதிரி தான் the body, when you see, if you want to increase glucose and decrease glucose, you have two hormones. It's a right mix. நம்ம அந்த சுகர் நம்ம காஃபியில் போடுற மாதிரி தான், கொஞ்சம் இதை ஊற்றி அதை அட்ஜஸ்ட் பண்ணணும். You can't put directly a sweet thing at that. Nature is very, very, so you can learn many things like this. You see at the molecular level, bone நாங்கள் பேசும்போது என்ன சொல்லுவோம், bone formation, bone resorption. ஃபார்மேஷனுக்கு ஆஸ்டியோபிளாஸ்ட், ரிசார்ப்ஷனுக்கு ஆஸ்டியோக்ளாஸ்ட். இது ஈஸி, இது வரைக்கும் செல்லுலாருக்கு வந்தாச்சு. சப் செல்லுலாரில் போனீங்கன்னா ஃபார்மேஷனுக்கு பீட்டா கேட்டனின் WNT, இதுக்கு வந்து ரேங்க் லிகண்ட். இதோட நிறுத்திண்டா ஈஸியாக இருக்கும். இங்கே நீங்கள் ஓப்பன் பண்ணிங்கன்னா வாட் ஆர் ஆல் த ஃபேக்டர்ஸ் கண்ட்ரோலிங் ராங் லைகண்ட், தெர் வில் பி another 10-20 ஃபேக்டர்ஸ். அதில் நம்ம ஹார்மோன்ஸ்லாம் நிறையா இருக்குது. தட்ஸ் வை இன் எண்டோக்ரைன் ஃபீல்டு வி ஆர் probing or poking our nose into every other field, because all these are at a basic level. You see here already anabolic hormones like growth hormone, insulin, thyroid, everything is required for bone also. Anything grossly you see as a defect in the system leading to a major effect on the body, they will have an effect on bone and muscle also. How can it not have when it is for general health? That is where this GH, IGF-1, one interesting fact which UGs may not be appreciating in their undergraduate books is these IGF-1 and growth hormone is from pituitary, we all know, and the classic teaching is growth hormone will act on the liver to produce IGF-1. However, IGF-1 is also generated locally. Locally means wherever it is required, especially in the bone. the growing bone. So that factors also help. Though it's not just a systemic endocrine IGF-1, it could be a local IGF-1 also. So they are required in the anabolic effects of the bone. Needless to say, how much the testosterone and estrogen plays a role, we see it grossly. A hypogonad male, even if you see 1 or 2 patients, you will never forget the way they will be weak. They can be, how much that androgen hormone is necessary for muscle health. Only you can see to believe it. Same way, after menopause, what happens to a lady and what happens in Turner syndrome or some problem with estrogen, if she is not developing the appropriate sex hormones, you will see a massive decline in both bone and muscle health. I am adding muscle for today's meeting, but generally we ask only bone. We assume that, see, ஒரு காலத்துல வந்து these things were not discussed in a big way. Another reason is they were active, generally very active. Let me tell you another clinical importance of today's discussion, this topic. Today you would have seen in our surgical field, everywhere this kind of, I would call it popularization or advertisement or whatever you want to call it. You know, you can keyhole surgery, robotic surgery, you come in the morning, afternoon you will go home, nothing, onnume irukadu. Have you seen those patients recovering? N number of times we will see. If they are already fit means physically. See, suppose somebody is undergoing a hernia surgery. Who will develop hernia? A docile, weak lady lying in the bed, she will rarely develop hernia. Only active people who are, due to some rent somewhere, some pressure is there, it comes out. Some active people can operate பண்ணீங்கன்னா அடுத்த 3 நாள் அவன் எல்லாம் நார்மல் ஆயிடும். அவன் ஏற்கனவே ஃபிட்டா இருப்பான். You talk to our army friends who are in army hospitals, they are the best to give you any kind of complex surgery done to those jawans and others, huge big accident, அப்படியே கால்லாம் அடிபட்டு என்ன அவ்வளவுதான் அடுத்த ஒரு வாரத்துல he'll be up and functional. That's because of his inherent, the baseline status, functional status was so good. But every other day we are seeing osteoporosis in elderly ladies who are not exercising or not keeping fit at all. அவங்களுக்கு நீங்கள் ஏதோ ஒன்று பண்ணுறீங்க, இல்லை கோலிசிஸ்டெக்டமி பண்ணுறோம், அப்டாமல் சர்ஜரி பண்ணுறோம், தொராசிக் பண்ணுறோம், அவங்கெல்லாம் ரிகவர் ஆகும்போது பார்க்கணும் நீங்கள். They will not recover that fast. இவங்க அந்த அட்வர்டைஸ் பண்ணுற மாதிரி வேகமெல்லாம் வர முடியாது. You have to give them so much of, அங்கே உடனே நல்லா ப்ரோட்டீனை திடீர்னு சாப்பிட்டு நியூட்ரிஷனை, அவங்கள திடீர்னு சிஏபிஜி பண்ணப்புறம் ஊது அந்த இதை ஊதுனா எங்கேருந்து ஊதுவாங்க? நீங்கள் முதல்லேருந்து ஊதி இருந்தால் தானே வரும். N number of times you are seeing, unless you are already primed for that. Elective surgeries ki idu romba important. Emergency okay, elective ku vandu you have to prepare them, make them fitter from this point of view also, muscle bone. Adhi நான் clinically very very important. சும்மா சாப்பிட்டோம் உடனே இந்த குழந்தைகளுக்கு ஒண்டி தான். ஈவன் குழந்தை, I tell all our patients, இந்த physiology நல்லா புரிஞ்சுக்க it will be interesting. See, 3 month old, 6 month old child, அதெல்லாம் படுத்துன்னு தான் இருக்கும், தூங்கின்னு இருக்கும் நல்லா. ஆனால் அது அழும்போதோ அது ஆக்டிவாக இருக்கும்போது கை காலம் வச்சுட்டே இருக்கும். You can't do that for even 10 seconds. The child will be continuously doing it. எங்கே இந்த அவ்வளோ எனர்ஜி, அவ்வளோ மசில், அதை அப்படியே தண்ணியில் போட்டிங்கன்னா அது ஸ்விம் பண்ணிவிடும். நம்ம அதை பண்ண மாட்டோம், சொல்கிறேன் நான். ஸோ ஈவன் த சைல்ட் நோஸ், it will appear like sleeping, but when active it will be super active. But we don't do it. அப்புறம் இப்போல்லாம் I don't want to go into the screen time and always on this and etc. So we make everything detrimental for our muscle and bone. Then நல்லா டிஸ்கஸ் பண்ணுவோம். போஸ்ட்மெனோபாசல் ஆஸ்டியோபோரோசிஸ், சார்கோபீனியா, நான் அந்த டெஸ்ட் பண்ணிட்டேன். மாஸ்டர் ஹெல்த் செக்கப்பில் இப்போ நாங்கள் மசிலும் இன்க்ளூட் பண்ணிட்டோம், பாடி காம்போசிஷனும் பண்ணுறோம். நானே பாருங்கள், ஐ எம் கேக்கிங் அகேன்ஸ்ட் மை ஓன் ஃபீல்டு, பிகாஸ் தட்ஸ் நாட் வாட் த சொசைட்டி வாண்ட். த சொசைட்டி ஹேஸ் டு பி இம்ப்ரூவ்ட் ஃப்ரம். இப்போ இதை படித்தா இதுலேருந்து என்ன தெரியணும்? மசில் போன் ஹெல்த்லாம் அசைஞ்சா போதும், நடந்தால் போதும்னு சொல்லணும். அதை சொல்லாமல் நம்ம என்ன பண்ணிடுறோம், அதுக்கு என்ன மருந்து கொடுக்கலாங்கிறோம். somewhere we are making a gross error there. So இதெல்லாம் எவ்வளோ வாட்டி பேசியிருக்கோம். விட்டமின் டி in the last 2-3 decades, the most hyped hormone. It's very very important. But unfortunately எல்லா மீட்டிங்லையும் கேட்பாங்க. Every physiology person, anybody who knows some physiology will ask, சார் சன்லைட்டில் போனால் விட்டமின் டி வராதா? அது எதுக்கு சார் நீங்கள் சப்ளிமெண்ட்டாக தரீங்க? இதில் இன்னொரு கேள்வி வேறு. டுடே விட்டமின் டி யூ செக் ஆன் எனிபடி, இட் இஸ் கம்மிங் லோ. அப்போ அதான நார்மல்ட்டான் தான். I asked also many times, I asked myself, when you check on almost everybody in the population, the value comes as 15, 18, 12. அப்போ அதான நார்மல். If you go by our usual Gaussian standard deviation curves, then how do you define a disease? Based on numbers? you should know the outcome. Outcome based இருக்கணும். Does that level correlate with இன்னைக்கு இந்த muscle, for example, muscle sarcopenia by functional definition ல vitamin D கொடுத்தா நல்லா ஆகுதா? Then you can come to a cutoff. So for knowledge purpose, endocrinologically, vitamin D deficiency, that value 20 is defined biochemically, the level at which hyperparathyroidism, secondary hyperpara, secondary to vitamin D low, PTH increases. That cutoff is 20. That is why that number 20 comes. It is not for gross clinical thing. Clinically it will not happen. Rickets and osteomalacia will not come at 20. It will be less than 15 usually. Anyway, just to give you the idea that some of these numbers, some of these things, எல்லாம் பாருங்க, நேச்சர், சன்லேருந்து, வாட்டர்லேருந்து, எல்லாம் அந்த பஞ்சபூதத்துலேருந்து தான் எல்லாம் வருது. We just forget that என்னமோ எல்லாம் யாரோ இருக்காங்க, ஏதோ ஒரு சேஷையில் தான் வருதுன்னு நினைக்கிறேன். இன்னும் கொஞ்ச நாளில் தண்ணி எங்கன்னா பாட்டிலில் இருக்குமா, அது கிணத்துலேருந்து வருது, நதியிலேருந்து வருதுன்னு கூட மறந்துடும். Anyway, then these new hormones are there. You know two more names today. We were thankfully during my training times, phosphorus was separate. We discussed a lot about phosphorus, but phosphorus was not controlled by any hormone except PTH directly. But today we have this FGF23 talked about in a big way, mainly because it is one of the important agents which excretes phosphorus in the urine if it is in excess. The topic is not for that today. See, this calcium, phosphorus, magnesium, potassium, all these are very, 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 very important for muscle mainly and bone. இதெல்லாம் நார்மலாக இருக்கணும். And vitamin D, just now we discussed, vitamin K, because all of these are collagen based, protein based actions. So it is I need not elaborate too much. You see, all these will play a role in muscle and bone health, not just one of these particular hormone at a particular place. It's a combined effect of all this. This new fellow is talked in a big way, myostatin, இப்போ ஒரு புது TGF beta super family based agent. Why are we discussing? Because it somewhere acts, as the name indicates, it makes the muscle regeneration, it inhibits. So anything which inhibits myostatin will improve muscle is the logic in which you can discuss. It's like a double negative statement made here. So it is having a feedback loop with the, we discussed the anabolic pathway, WNT pathway and rank ligand. Myostatin apparently has a negative effect on the WNT pathway. We have a molecule now. அதனால தான் இது பாருங்கள், பெரிய ஸ்லைடில் பெரிய இதுக்கு வந்துச்சு, இல்லைன்னா ஓரமாக இருந்திருப்பான். அண்ட் இப்போ தான் அவர் சொன்னார், நம்ம டாக்டர் தீபக், ஹீ இஸ் டூயிங் அ PhD ஆன் திஸ். கண்ணன் சார் தான் வேறு கைடுன்னு சொன்னார். ஐரிசின் அனதர் மயோகைன், யூ சி, PhD வந்துடும் ஒன்று, தப்பு கிடையாது. டெஃபினெட்லாக இந்த மாதிரி தான் ரிசர்ச் வந்து இதுலேருந்து ஏதாவது ஒன்று வரணும். In that real frail patient who cannot exercise, who have multiple conditions, these molecules are important. Who said no? That's how science grows. This will spoil anybody's morning if I start reading one arrow everywhere. So just I am happy with this slide that you see how much of interaction is happening at a molecular level. That's the gross thing. And grossly we are a balance between the muscle forming and the muscle degenerating, bone forming and the bone resorbing factors. Two important or common here. The WNT beta canine pathway and that NF kappa B. These are common between the two. So if somebody asks tomorrow in the, for academic purpose, if you want to learn one point, you learn that the inflammatory pathway related NF kappa B and the WNT are common between muscle and bone. Otherwise muscle and bone are, நம்மள என்ன நகமும் சதையுமா இருக்கணும் போமா, இல்லை எலும்பு சதையுமாவா? What is it saying in Tamil? நகமும் சதை தான், லட்சா நான் அதை எலும்பு சதைன்ட்டேன். சரி பரவாயில்ல, இந்த டாக்குக்கு அதுவும் சேர்ந்து தானே இருக்குது. தான் ஆடலைனாலும் தான் சதை ஆடுமாங்கல்ல, அதையும் ஆடும் அப்படி தனியாக. அது ஆடினா அப்போ மசில் ஹெல்த்தியாக இருக்கும்னு அர்த்தம். ஓகே. அண்ட் if you want you see any protein, anything which we discussed is indirectly a protein, you will agree with me. The beta catenin, the sclerostin, the FGF23, obviously they should have a gene. அந்த ஜீனுக்கு ஒரு mRNA இருக்க தான் இருக்கும். அந்த mRNAல there will be two mRNAs today. One is the inhibitory, one is the expressive mRNA. ஸோ இது இப்படியே போயிட்டே இருக்கும் நீங்கள் அந்த ரிசர்ச் லெவலில். ஸோ the mRNAs which are controlling these factors which we discussed. See, I am deliberately avoiding reading out all these names. 2,3A, B, 3P எல்லாம் படித்தா you won't remember the overall concept itself. எங்கே போகுதுன்னு கூட தெரியாது. அப்படி தான் எனக்கு இருந்துச்சு when I read many of these first time. Then comes management. What do you think is the management? So sarcopenia irukku, osteoporosis irukku. Now I am not going to move the slide. Anybody from the UG side? How will you manage? Suppose I ask osteoporosis. How will you classify? Let me give you a clue. Once osteoporosis setting in, 70-year-old has come with a fracture, that's a different thing. Leave that. All the ladies, especially the younger ones, less than 30-year-old sitting here, prevention. Prevention everybody. You should prevent, it is like they say, no, bank balance mari. You should invest in your bone now by adequate nutrition and adequate physical activity. Your bone and muscle should be at their peak when you are in that 20s and 30s. After 35-40, it is going to be a few percentage decline every decade. அது ஏஜிங். 60 வயசுக்கு அப்புறம் முழிச்சுண்டு நான் திருப்பி 30 போகிறேன்னு சொல்லி பார்த்தீங்களா, நிறையா செலிப்ரிட்டிஸ்லாம் திடீர்னு யங் லுக்கிங் ஆகி நீங்கள் எவ்வளோ தான் டை அடிச்சுட்டாலும் எவ்வளோ தான் மேலே பவுடர்லாம் போட்டாலும் it will be showing up on your face. You can't go back. You can't reverse time. You can't reverse everything. However, you can build up the bone very well now. All young ladies are smiling here. And India, previously it used to be an interest, the societal norm that ladies most often will get married very early. In the by late 20s, they will have at least 2 or 3 children. And every time during pregnancy and lactation, it is a very big stress on nutrition and bone. But let me tell you the physiology. We have written review articles on that. If you want, you can read that. Calcium, vitamin D, phosphorus balance during pregnancy. How many of you, from today she is conceived, 10 months and another 6 months postpartum, what will be her bone? Any guesses? You understood? No, there will be a big stress. The fetus is taking everything. Lactation, both its milk draining from her. Adequately well-nourished lady, from the onset of pregnancy till she completes lactation, her bone density will not even decrease by 1%. It will be absolutely normal, regained fully. For this, nature has kept several mechanisms. One of the important mechanisms, you can read about it in greater detail, is both the placenta and the breast, lactating breast, will secrete what is called PTHRP. You all know that is a related peptide. That has tremendous capacity to absorb phosphorus and calcium, and it will that is why you see 8 children, 9 children. My grandmother had 8, another grandmother had 10, but without osteoporosis, 94 years, standing erect. அது எப்படி நடக்கும்? Think about, see, that means the body has enormous capacity to compensate. Today, in the name of weight loss or some other thing, I avoid this. Once you start avoiding the wholesome nutrition, then you might miss out on something, and obviously there will be a punctuation happening in your health. So the management from the sarcopenia point of view is nutrition and exercise. I am happy that exercise is stressed, and exercise இப்போ முன்னெல்லாம் நாங்களாம் வெறும் வாக்கிங் பண்ணால் போதும், அட்லீஸ்ட் 30 minutes a day. American Heart Association guideline, which is absolutely correct. Something is better than nothing. உட்காண்டே இந்த டிவியை பார்க்குறதோட அட்லீஸ்ட் நடக்கிறாங்க கொஞ்சமாவது நடக்கும். When you walk, actually your gluteal, your thigh and other muscles, actually they bear the weight. So obviously it's a weight bearing exercise for the lower limb, but nothing for the torso and the upper limb. That's why we have started putting that extra word now, resistance, with minimum resistance training. So இந்த ரொம்ப பெரிய பாட்டிலாக கொடுத்துட்டாங்க. 500 ml பாட்டில் வச்சுட்டு அது அட்லீஸ்ட் ஒரு 10 வாட்டி 20 வாட்டி, இதெல்லாம் நம்ம ஊரில் ஈஸியாக சொல்கிற விஷயங்கள் தான். You can learn more on this. Simple things told to our patients will carry a long way in their maintaining their muscle. But, and obviously, இதுதான் ப்ராப்ளம். ப்ரோட்டீனை தனியாக சாப்பிட முடியாது. Protein has to go with something. Today, unfortunately, even chicken stalls everywhere, they are writing protein. Obviously, it contains, and those chickens, how they are grown, have you seen the poultry farm? Have you seen the commercial poultry farms? They are kept in one closed cage. They have to gain that 1 kg within that period of time. They are overfed, and they should not contract infection, so they are given antibiotics and other things. They are pumped with vitamins. They become plumpy. All the muscles will be actually having a lot of fat, and that's why it's very tasty. Anyway, so you should have adequate protein, vitamin D, calcium and all cannot be overemphasized, but exercise. And the right half விட்டுருங்க. இன்னைக்கு என்ன ஆயிடுச்சுன்னா, all these discussions are heavily focusing on the right side. இதை கொடுக்கலாமா அதை கொடுக்கலாமா. நீங்கள் இந்த பேசிக் எக்ஸசைஸு நியூட்ரிஷனை விட்டுட்டு நீங்கள் எவ்வளோ தான் அந்த பக்கம் பண்ணாலும் ஒன்றும் எஃபெக்டிவாக இருக்காது. Except in people who have the deficiency of something. For example, a child with growth hormone deficiency, an adult with a pituitary problem, or somebody who had premature menopause, or a male with hypogonadism. We are not discussing that here. And as an endocrinologist, I can go on and on discuss on those. See, when somebody is deficient, you replace the correct deficiency, you see the difference. That's how vitamins were discovered. Vitamin C, scurvy, vitamin B1, you know all those were discovered in extreme forms of what happens during the deficiency. However, today what we are doing, we are overdoing things on normal people. இந்த சாப்பாடு கூட அப்படி தான். சாப்பாடே நீங்கள் பார்த்தீங்கன்னா இப்போல்லாம் அந்த இப்போ நிஜமாகவே அந்த பசி பட்னியில் வாடுறவனுக்கு நீங்கள் போய் சாதம் போட்டிங்கன்னா அந்த சோறை எவ்வளோ மலை மாதிரி குஞ்சு சாப்பிட்டா ஒன்றும் ஆகாது அவனுக்கு. இப்போ நான் கல்யாணத்துக்கு போனேன்னா என்ன சாப்பிட்டாச்சா 4 வாட்டி என்னை கவனிச்சு நீ பாயசம் குடிச்சிங்களா அதை டேஸ்ட் பண்ணிக்கலாம் பண்ணால் நீ ஏற்கனவே ஓவர் ஃபெட்டாக இருக்கும். இதில் இன்னும் கொஞ்சம் சாப்பிட்டு நாக்குக்காக சாப்பிட்டா பிரச்சனை வருது. அதே தான் இங்கேயும். ஸோ ஐ திங்க் த நியூட்ரிஷனல் ஆஸ்பெக்ட் அண்ட் எக்ஸசைஸ் ஆர் த ஒன்லி ரீசன் டு ப்ரிவெண்ட் சார்கோபீனியா. Prevention is better than cure. We only talk like this. Prevention should happen from younger age. Get your bone and muscle to your peak strength by the age of 30-35. Then also adukku neenga pandra exercise எல்லாமே உங்களுக்கு it will maintain for a period of time. So and address all the risk factors which might be there. Especially we as physicians are focusing on this comorbidities area, controlling all their other conditions reasonably well so that they have some functional reasons to work better. நீங்கள் அவங்கள போய் எக்ஸசைஸ் பண்ணுன்னா நேற்று ஒரு பேஷண்ட் என்கிட்ட ரொம்ப நேரம் ஆர்கியூ பண்ணாங்க. அவங்களுக்கு முட்டி அவங்கள நடன்னு தெரியாதனமான ஒரு வாய் வந்து இல்லை எனக்கு முட்டியை வலிக்குது என்ன சார் நீங்கள் போய் என்ன நடக்க சொல்கிறீங்க. அப்புறம் உடம்பு அப்போ ஷோல்டரை வலிக்குது கை. நான் கேட்பேன் உடனே அடுத்த கேள்வி வந்து இந்த போலியோ அட்டாக்கு வேறெல்லாம் அந்த மாதிரிலாம் பாவம் வந்த அந்த பேஷண்ட்ஸ்லாம் அவங்களாம் எக்ஸசைஸ்லாம் பண்ணுவாங்க தானம்மா நீங்கள் அந்த மாதிரி உட்காண்டே எதாவது பண்ணுங்களேன்னு. இல்லை சார் இங்கேயும் வலிக்குது எங்கே கேட்டாலும் வலிக்குதுன்னு சொன்னால் அப்போ தென் வி ஆர் ரூலிங் அவுட் ஆல் தி சிஸ்டமிக் கண்டிஷன்ஸ் விச் கேன் காஸ் தி பெயின். சி அல்டிமேட்லி அப்புறம் பார்த்தா அவங்க ஃபேமிலியில் ஒரு ப்ராப்ளம், பொண்ணு அமெரிக்காவில் இருக்கா, பையன் இங்கே இருக்கான், அவங்க மைண்ட் அங்கே இருக்குது, அவங்களுக்கு இங்கே ஃபங்க்ஷனல் ஆஸ்பெக்ட்ஸ் ஆர் தேர். See how holistically it changes. She is not having the drive to get up and walk. இதுக்கு யார் சரி பண்ணுறது? நாங்கள் உட்காந்து டயபிட்டிஸ் HbA1c நல்லா இருக்குது, கால்சியம் ப்ரிஸ்கிரிப்ஷனில் கரெக்டாக இருக்குது, பாதி பேர் கால்சியம் போட்டுக்க மாட்டாங்க, சாப்பிட பிடிக்கலாம்பாங்க. Holistically, if you see a patient, no, the problem sometimes will not be in what you see in the reports. Biochemistry helps us know their family problem. Anyway, பார்த்தீங்களா? These molecular mechanisms have to be done to see where could be the fault, where we can address. And as I already said, this myostatin is becoming an increasing area. A lot of research has been done to the extent. பாருங்க இப்போ உடனே நம்பரில் இப்போ இந்த மாதிரி ஒரு ஸ்லைடு போட்டு பேசிட்டா என்ன ஆகும்? நீங்கள் நல்லா ஹோல்சமாக நல்லா சாப்பிடுங்க, இதெல்லாம் சாப்பிடுன்னு சொன்னால் கரெக்டு தான். நோபடி டினைஸ் ஆல் தட். ஹவெவர் கிவிங் எவ்ரிதிங் as supplement, the supplements are becoming more costly than your normal food. Please think about all this. I'll skip some of this to tell you that repurposing. You see, the moment you know such molecular mechanisms are available, so many studies are there. This slide is to tell you how many molecules are now in different phases of clinical trials and phase 1 trials to find out whether they have an effect on muscle, whether they have an effect on bone. இதெல்லாம் இன்னும் கொஞ்சம் நாளில் பாப்புலரைஸ் பண்ணுறதுக்காக இன்னும் சார்கோபெனிக் டாக்ஸ் அதிகமாகும். ஐ எம் ஷுவர் ஒன் ஆஃப் தம் இஸ் ஆல்ரெடி கம்மிங் அப் அண்ட் தட் இஸ் திஸ் ஃபெலோ கால்ட் பீமாக்ரூமேப். நான் அதையும் வந்து இந்த பீமா மாதிரி ஆகிடுவோன்னு வச்சுருந்தேன். பீமாக்ரூமேப் என்னென்னா, திஸ் இஸ் அன் ஆக்டிவின் ரிசெப்டார் ஆன்டகனிஸ்ட். இட் இன்டைரக்ட்லி சப்ரஸஸ் மயோஸ்டாட்டின். இது ஏன் தெரியுமா இவ்வளோ பண்ணாங்க? Because this famous drug called Ozempic, you all know that semaglutide apparently reduces weight, so people lose fat, but they lose muscle also. They have sarcopenia as a complication of that drug. So how to address the sarcopenia? Give semaglutide along with bimagrumab. Mathematically correct, equation wise correct. Whether practically correct or not, only time will say. Fortunately, bimagrumab is not yet come into the market, but it is having some side effects which are making them delay. There is a delay in this. So just to tell you how sarcopenia can be approached pharmacologically and interventionally rather than just thing. See, already big phase 3 trials are there. So this is the last slide. To summarize, I think we would have learnt this fact and re-emphasized and learnt it once more that muscle and bone should be ideally seen as one unit, musculoskeletal unit. And aging affects both together. Though we don't diagnose osteosarcopenia today, each is diagnosed independently, and you can join the word to know the concept as together. Conditions which affect the bone and muscle, multiple comorbidities, they do together actually, and we should approach it from a strength and functional aspect rather than just a muscle density aspect. And nutrition and exercises are the cornerstone of therapy for both osteoporosis and sarcopenia. And in exercise, you add one more term, resistance, to make it better for muscles. This last slide, I put it in our national conference in Society of Bone Mineral Research in Mysore last year. This is, it hit me hard when I read it somewhere. You see here, why I am talking slightly philosophically is this kind of good statements by great thinkers. This is one MIT cancer researcher, Weinberg. He is writing about cancer. You can't die from cancer if you don't get it in the first place. You see, looks like that's prevention at primordial level. But that simple truth is easy to overlook because it is not intellectually stimulating. Persuading somebody to quit smoking is a psychological exercise, but people won't like it. நீங்கள் திருப்பி கவுன்சில் பண்ணி ஸ்மோக்கிங் நிறுத்தினா எல்லாம் சரியாக பண்ணி சொல்லி பாருங்கள், நிறுத்த மாட்டோம். It has nothing to do with molecules, genes and cells. And people like me, அது அவர் சொல்கிறார், நான் இல்லை, are uninterested because என்னப்பா ஸ்மோக்கிங் நிறுத்தினா எல்லாம் ஆகிடுமா. But the basic underlying issue is காம்ப்ளெக்ஸாக ஒரு ஸ்லைடு போட்டு அப்படியே அதை அப்படி ஆகும் இப்படி ஆகும் பேசினா it will be appealing. It could be literature wise, it could be science also. So you can actually do a better public health service by asking people to stop smoking, stopping alcohol rather than prescribing any of the modern agents in chronic disease. This is the hard truth. But நான் இப்போ சொல்கிற மாதிரி இதே மாதிரி பச்சை எல்லாத்தையும் சொல்ல முடியாது. Thank you very much for your kind attention and thank you.
Thank you so much. Thank you so much, sir, for enlightening us with your amazing talk. You beautifully explained how muscle and the bone are not isolated structures, but a part of a complex endocrine conversation, especially when it comes to the context of aging. I now open the forum for discussion. If you have any questions, you can shoot it now. Any questions from the audience? I'm not a sports medicine person to answer that, but in general, cardiac fitness is required for. In yoga, what do you do? When you hold a muscle contracted in a particular position for a long time, you call it isometric. So for all those things, you actually should have in middle age and elderly people, diabetes, etc. Cardiac clearance kapra rendu onnu dhaan from all these perspectives. I don't see a big difference between the two. Culturally, some things are more appealing. Some things you don't require too much of gadgets and space. I think isometric falls into it. So adanala that is whatever is practical. இப்போ இந்த மாதிரி எசோட்டரிக் அண்ட் மோர் இன்டெலெக்சுவல் டிஸ்கஷன்ஸ் வில் லீட் டு மோர் டிஸ்கஷன்ஸ் ரேதர் தேன் டூயிங் த திங். இப்போ எல்லாம் டோன்ட் டாக், வாக் த டாக் அப்படிங்கிறோம். ஸோ த சேம் மீட்டிங் கேன் பி சப்போஸ் வி டாக் அந்த மாதிரி சொல்ல ஆரம்பிச்சிட்டோம். ஐ ஃபுல்லி அக்ரி. சயின்டிஃபிகலி யுவர் கொஸ்டின் இஸ் கரெக்ட், பட் த ஆன்சர் இஸ் சம்திங் இஸ் பெட்டர் தேன் நத்திங். சரி.
Hello, sir. So it was a nice session, sir. As a biochemist, I learned so much mechanisms which comes under this osteosarcopenia.
You know, sorry to interrupt. My close friend, she is a pediatrician today in the UK. When I got the DM seat, the results were announced in the institute. That night she told me, so don't mistake me, the biochemistry people here. No, she said, so you are going to become a glorified biochemist. Because endocrinology is full of such diagrams. And embryology அப்படிதான். The embryology பாடம் எடுக்கிறதுக்கு முன்னாடி you should not go too much into that cell division, morula, அந்த அதுக்குள்ளேயே படிச்சிருந்தா you will never come to how the organs are formed and all.
Exactly.
So that's the mistake we do. Biochemistry நீங்க இன்னும் ப்ராக்டிக்கலாக இன்னும் you know, why you should not do this, what happens, அந்த மாதிரி கேட்டால் இன்னும் கொஞ்சம் அப்பீலிங்காக இருக்கும்.
ஆமாம் சார்.
இல்லைன்னா அந்த pathways are always.
எக்ஸாக்ட்லி சார், எக்ஸாக்ட்லி.
சொல்லுங்க, நீங்கள் என்ன கேட்க வந்தீங்க?
சார், எனக்கு வந்து என்னென்ன இப்போ ஆஸ்டியோபோரோசிஸ் அண்ட் சார்கோபீனியா பேஸ் பண்ணி வந்துட்டு ஆஸ்டியோசார்கோபீனியா சொல்கிறோம். ஸோ ஐ ஹாவ் அ கொஷின், லைக் ஐ ஹேட் நோன் அ பர்சன், அ பேஷண்ட். He have an osteoporosis, and also it was initiated with the arthritis, and it was then later stage osteoporosis happened, and now he is suffering with the myeloma.
Myeloma.
Yes. So is there any as we are talking about crosstalks, so I was very curious about the mechanistic evaluations of this particular condition, sir. So
The first part of your question is very well interrelated. For example, a patient with an inflammatory condition like rheumatoid arthritis or something will have severe osteoporosis also, and because of the arthritis and disuse, they won't use the joints well, they won't move well, they can have severe sarcopenia also. And the drugs which are used for rheumatoid arthritis, whatever it is, especially steroids are the primary. If steroids today are used sparingly, even otherwise they have an impact. The inflammation itself causes damage to both, especially bone is proven, joint is devastated by the disease, and muscle is secondarily affected because you don't move the muscle, or pain, whatever. இதுக்கும் மைலோமாவுக்குலாம் சம்மந்தம் இல்லை எனக்கு தெரிஞ்சு. மைலோமா இஸ் அன்ஃபார்ச்சுனேட்லி an accident in that man. I don't know, I pray for him to recover well, but I don't think there is a relation. அப்படி இருந்தா ஏதாவது இருக்கலாம், but we don't see that.
Yes, sir. There is one more condition.
I don't think so.
There is one more condition was happening, like he have a severe back pain with muscle and bone compressions in D3 and D4 some regions.
Those things are well explainable by the systemic nature of rheumatoid arthritis.
Yes, sir.
Rheumatoid arthritis doesn't affect the spine primarily. It is not a spondyloarthropathy.
Even they undergone knee replacement surgery also, so has he have some issues.
But secondary to the drugs used, steroids, inactivity, disuse, and steroids, etc., you will have osteoporosis. You can have fractures. அதெல்லாம் அப்படியே cascading.
Mild fractures also happening.
I can understand the overall scene in which you are discussing, but it has இவருக்குலாம் தான் இந்த மருந்துலாம்.
Exactly, sir.
The last in the Bima Grumab எல்லாம் இவருக்கு தான். Provided Bima Grumab does not aggravate something. You know, it
exactly,
has to be a safe
sir.
drug.
Yeah. Thank you so much, sir.
You can't ask him to jump tomorrow and exercise and make his muscle better. No, you can't do that.
The patient was
exact
in the
situation.
living. Yeah. It's he is in a severe pain, so he is still in a life.
You have discussed a very good question. நல்ல ரொம்ப கஷ்டம் அந்த கேஸ். அவங்களுக்கு நம்ம இங்க பேசினதெல்லாம் நிறைய அப்ளை ஆகும். இவருக்கு தான் மருந்து.
Thank you, sir.
Sir, so many viral infections are cropping up, like viral infections, chikungunyas அந்த மாதிரி. Post viral or post these infections for a prolonged period in the sarcopenias இருக்கு. Like அதுக்குமே like drug interventions தான் பெட்டரா இருக்குமா இல்ல ambulations அந்த மாதிரி depending on
அது கிளினிக்கலா தான் அப்ரோச் பண்ணனும். அந்த பேஷண்ட் இப்போ நீங்க சொல்றதெல்லாம்
all inflammatory molecules
usually ஒரு 6 weeks 12 weeks குள்ள recover ஆற கண்டிஷன்ஸ்லாம் நீங்க somehow you can make them come back to கொஞ்சம் மோட்டிவேஷன் தான் தேவை. அதான் எங்கள்ல நாங்க ஒரு மீட்டிங்ல நான் அப்படிதான் அந்த பாலிசிஸ்டிக் ஓவரி பத்தி எங்கேயோ பேசியிருந்த போது எல்லா மெக்கானிசம் ஆச்சு எல்லாம் பண்ணி because ultimately it also boils down to weight reduction and exercise and other things, no? So I said vocal therapy தான் பெஸ்ட் அப்படின்னு. எல்லாரும் என்ன சொன்னீங்க? vocal therapy னா you have to talk to the patient more, make them understand. So இப்போ நீங்கள் உங்களோட healthy young patient having who was healthy before had a viral infection, post viral diagnosis correctா இருந்தா it is going to recover. It may
many people கொஞ்ச நாளைக்கு நடக்க முடியல, மாடிப்படி ஏற முடியல, அந்த மாதிரியான
நம்ம drugs எல்லாம் important. drugனா not sarcopenic drug. அந்த pain killer whatever they use, no sparingly. I am sure Kannan sir can answer this better. அதெல்லாம் கொடுத்து அவங்கள நல்லா நீங்கள் ஃபங்க்ஷனாலிட்டி கொண்டு வந்துட்டு அவங்க நிறைய they will come back to normal. நான் அதை அப்படி தான் பார்க்குறேன். இந்த ஸ்போர்ட்ஸ் பீப்புள்லாம் அப்படி தானே, they have a injury இதெல்லாம் வருது, அப்புறம் they exercise and somehow come back to normal, no?
So most as you, I can get your point. Finally it is handle it in a simpler way. Molecules பெருசா முழுங்கறதுல இல்ல அப்படிங்கிறது.
அது இல்ல,
அதான்
ஆஸ்டியோபோரோசிஸ் இருக்கு, பட்
இருக்கு.
use it correctly in your requiring patient,
Okay.
judiciously, accurately.
That is exactly, sir, you are mentioning.
We should not go with the message that the drugs can replace your overall
Okay.
lifestyle modification.
That is it, sir. When you were talking about in the Ozempic, non-medical people are taking up. Nowadays, I'm frequently coming up with this magnesium gummies, magnesium things, and it's vitamin D promote பண்ற மாதிரி magnesium is being இப்போ நிறைய ஃபேஸ்புக்கில் இன்ஸ்டாஸ்லாம் கூட மெக்னீஷியம் போட்டுட்டா உனக்கு அந்த கால் குடைச்சல் போயிடும் சர்கோபீனியாஸ்னே வேர்ட்ஸே யூஸ் பண்ணுறாங்க யாரோ. ஹவு டு யூ see this? என்ன
ஒரு கெமிக்கல் இந்த
அப்ஜெக்ஷன்ஸ் ரேஸ் பண்ண முடியுமா ஏதாவது நான் அந்த மாதிரி?
ரைஸ் பண்ண முடியாது. See, everything has one rider at the bottom. It is like saying, smoking, இன்னிக்கும் வந்து டொபாக்கோலாம் வித்துட்டு தான் இருக்காங்க. Smoking kills, smoking causes cancer, smoking is injurious to health ன்னு ஒரு ஸ்டாட்யூட்டரி வார்னிங் கீழே போட்டுருவாங்க.
ஆமா.
அப்புறம் இதில் ஒரு ஓரல் கேன்சரோட ஃபோட்டோவை போட்டுருவாங்க. அதை கீழே போட்டுவிட்டு இவன் ஸ்மோக் பண்ணிட்டு இருப்பான். அந்த மாதிரி அல்டிமேட்லி தி பீப்புள் ஷுட் சேஞ்ச்.
பட் திஸ் இஸ் a formulation.
ஃபார்முலேட் இந்தியாவில் வந்து அந்த ரெகுலேஷன் வந்து ஒன்லி குவாலிஃபைட் ப்ராக்டிஷனர் ஷுட் ப்ரிஸ்கிரைபுங்கிறதுல வர ஸ்லாக்னஸ் தான் இதுக்கெல்லாம் காரணம். இல்லைன்னா எப்படி ஒசம்பிக் அண்ட் மவுஞ்சாரோ ஆர் ஆல்ரெடி கான் இன் டு ஃபிசியோதெரப்பி அண்ட் டயட்டீஷியன் அண்ட் எல்லாரும் எழுதிட்டு இருக்காங்க. ஆன்லைனில் ஜபக்குன்னு வாங்கிடுறாங்க. ஒரு பேஷண்ட்டு கண்ணன் சாருக்கு நல்லா அப்ரிஷியேட் பண்ணுவார்னு நினைக்கிறேன். போன வாரம் வந்தார், எங்களோட வார்டு பயங்கர வாந்தி. என்ன பண்ணிட்டாரு, ஆன்லைனில் ஒசம்பிக் ஒரே நாளில் ஃபுல் டோஸையும் போட்டார். அது 4 வாரம் போடணும். 0.5 அவர் 2 மில்லிகிராம் ஒரே நாளில் போட்டார். இதெல்லாம் வந்து ஆன்லைனில் வர வேணாம் மேடம். எல்லாத்துக்குமே ரெகுலேஷன்லாம் இருக்குது மேடம். பட் பீப்புள் ஆர் ஃப்ளவுட்டிங் ரூல்ஸ் மேடம். அது மெக்னீஷியம்க்கு தானே மேடம் ஆகும். வாட்டருக்கே ஆயிடுச்சு மேடம். தண்ணியில் விற்க ஆரம்பிச்சிட்டோம்ல பாட்டில். The day I'm not going into the political aspect of it. We are not able to provide potable, safe drinking water to the whole population. We are not able to. Now, where are we discussing? So magnesium will be sold. Every electrolyte in your body, every chemical in your body is a multi-billion-dollar business. Let us accept that also. But I am not saying that everybody is doing business. You should know when it is not a business. அப்போ நீங்கள் பாடம் எடுக்கிறதுலாம் பிஸ்னஸா? சம்பளம் கொடுக்கறது கரெக்டு தானே? கவர்மெண்ட் டீச்சருக்கும் தானே சம்பளம் இருக்குது. யூ ஷுட் நோ த டிமார்கேஷன், நோ வேர் எஜுகேஷன் பிகம்ஸ் அ பிஸ்னஸ், வேர் எஜுகேஷன் இஸ் ஆக்சுவலி டூயிங் குட் டு த சொசைட்டி. அதே தான் மெக்னீஷியம்க்கும் அதே தான் எல்லாம் இருக்கும். நீங்கள் எங்கே அதை கரெக்டாக யூஸ் பண்ணுவோம் அங்கே யூஸ் பண்ணால் அது கரெக்டு. தட் வே ஆஸ் ஃபிசிஷியன்ஸ் வி ஆர் அட் அன் அட்வான்டேஜ் டு பேலன்ஸ் போத் அண்ட் கிளினிக்கல் மெடிசன். அதுக்கு தான் நீங்கள் அது ஓவர் போர்டாக போய் எல்லாரும் மெக்னீஷியம் போடுங்க. இப்போ இருக்கிற எல்லா டயட்லையுமே இல்லை. அப்புறம் எதுக்கு பழம் சாப்பிடணும், எதுக்கு சாப்பிடணும், எதுக்கு நட்ஸ் சாப்பிடணும், எல்லாத்துலையும் தானே மெக்னீஷியம் இருக்குது.
இதெல்லாம் பார்த்து எல்லாரும் போட்டுக்க ஆரம்பிச்சுருவாங்கல்ல. அப்போ
அது என்ன மேடம் பண்ண முடியும்? எல்லாரும் ஒரு சினிமா ஆக்டரை பார்த்து ஏதாவது ஒரு ஹேர் கட் பண்ணிக்கிறேன், ஏதோ பண்ணிக்கிறேன், எல்லாரும் பண்ணிப்போம்ல. அதுக்கு என்ன பண்ணணும்? அது ரெகுலேட்டரி கொஸ்டின், நாட் நம்மளால அதுக்கு ரொம்ப பண்ண முடியும். நம்ம கரெக்டாக பண்ணலாம், நம்ம ஸ்டூடெண்ட்ஸ்க்கு கரெக்டாக சொல்லி தரலாம். ஐ ஹோப் தே வில் டேக் தி பாயிண்ட்ஸ் இன் த ரைட் வே.
சார், இது ஹார்மோன்ஸ்ல how about cortisol in the mechanism, sir?
Amma, cortisol in excess. Cortisol in excess is detrimental, well proven. Steroid induced, glucocorticoid induced osteoporosis, glucocorticoid induced myopathy, very well known.
So stress lo cortisol increase ஆறதுனாலயும் இந்த mechanisms, all cellular mechanisms,
if that stress, this is a very very tricky question. Madam இங்க ஈஸியா கேட்டாங்க, எனக்கு எங்க எல்லாம்லாம் போறது thought process. The issue is whether the stress is acute and whether it is going to go off in a period of time, or whether it is a chronic stress, and whether you have adapted to the stress or whether you have maladapted to the stress. இப்போ நான் 8 classification பண்ணிட்டேன். Stressங்கிற வார்த்தை Hans Selye, you all know that famous man, he discovered the term stress. Stress is the term, we have borrowed it from physics actually. Stress and strain or அந்த ஒயர் அதோட அதில் எவ்வளோ ஸ்ட்ரெஸ் வச்சு அது எவ்வளோ இழுக்கும், அதை வச்சு தான் அதை கொண்டு வந்தாங்க. The interesting thing, the concepts were very clear. They did autopsy on those deers after it was chased by the lion or thing. No, the changes which occurred in that deer during that last 2-3 minutes of whatever happened, or if the deer escapes, you can take a blood sample of the deer and see how much is down. அப்படி கண்டுபிடிக்கப்பட்டது தான் இந்த ஸ்ட்ரெஸ் ஹார்மோன்ஸ்லாம். இப்போ அந்த மாதிரி பர்சீவபிள் டைரக்ட் த்ரெட் ஸ்ட்ரெஸ் இருக்கா? இப்போ கல்ஃப் இருக்கு, உங்களுக்கு இருக்கு. இப்போ கல்ஃபில் இருக்கிற முக்காவாசி பேர், my relative, one of our relatives called a few days back talking to my wife. It was pathetic to hear what he was saying. Anytime anything can fall. It is not the bomb which is going to fall. They are saying that what he shared is the shell. The bomb போட்ட அப்புறம் அந்த ஷெல் வந்து கண்ணா பின்னான்னு வருது, விழுறது. Several people have died because of that. And continuously you are hearing bomb news. Will you be normal? இப்போ அது என்ன ஸ்ட்ரெஸ்? இப்போ அந்த ஸ்ட்ரெஸ் முடியுமான்னு தெரியாது. இதுவாவது perceivable stress. You know there is a war going on, there is a problem, you are in the problem area, so you have a stress. What about the other stress? What we are all facing? Perceived, unperceived. No, it's not perceivable, it's not seeable. But you are perceiving that something is wrong. நான் எக்ஸாமில் பாஸ் ஆவேனா, நான்லாம் எதுக்குமே சரியில்லை, இப்படின்னு ஏதோ ஒரு ஸ்ட்ரெஸ்ஸை நீங்களாக வளர்த்துண்டு அவன் என்னை தப்பாக சொல்கிறான். கிளிக்கு வரலையாம். The number of clicks, he has put a blog and people didn't know, and he is worried about why the clicks are low, why you didn't see my message. இதெல்லாம் ஸ்ட்ரெஸ்னா அப்புறம் நான் எங்கே போகிறது? அப்போது நீங்கள் எப்போ பார்த்தா ஸ்ட்ரெஸ்ஸில் இருக்கீங்க. அப்போ அந்த ஸ்ட்ரெஸ் பாதிக்கும். அக்யூட் ஸ்ட்ரெஸ்ஸில் அந்த மான் அப்புறம் நார்மல் ஆகிடும். See, the body has been devised in such a way that these acute stresses will also recover acutely. But we have made it into a chronic version, and you have got adapted wrongly to that chronic version. That is the main pathophysiology behind most of the chronic diseases. ஸோ அது போனாலாம் பாதிக்கும்னா, அம்மா பாதிக்கும் தான் பாதிக்கும், ஏன் பாதிக்காது? நீங்கள் அதையே யோசிச்சு நீங்கள் அதுக்காக நடக்காமல் உட்காந்துருந்தீங்கன்னா. ஸோ அல்டிமேட்லி இதில் ஒரு நியூரல் காம்பனண்ட் வருது பார்த்தீங்களா, எமோஷனல் அண்ட் நியூரல். சி அல்டிமேட்லி யூ ஹேவ் டு பி ஹாப்பி ஆல்சோ, நோ, தென் ஒன்லி எவ்ரி திங் வில் ஒர்க் வெல். மசிலில் வேலை செய்யணும், சும்மா இப்படி பண்ணிகிட்டே இருந்தால் வருமா? யூ ஷுட் ஃபீல் ஹாப்பி ஃபார் டூயிங் இட். நான் எங்கள் பேஷண்ட்ஸ்லாம் இப்போ ஆடட் ஒன் மோர் ஸ்டேட்மெண்ட். ஐ திங்க் கண்ணன் சார் மைட் திங்க் இவருக்கு என்ன ஏதாவது எங்கேயாவது கொஞ்சம் லூஸ் ஆகிடுச்சு போல இருக்குன்னு நினச்சிக்கலாம். See, I tell our patients, they are on chronic medications. You start them on insulin. Most often when I start insulin in an uncontrolled diabetic patient, you should see their face. அவங்க எல்லாரும் என்னமோ நான் ஏதோ தண்டனை கொடுக்குற மாதிரியும், அது ஏதோ ஒரு ஒர்ஸ்ட்டு மருந்து மாதிரியும், அது அவங்களுக்கு வந்து அது வேண்டாவர். நான் அப்புறம் அதான் சொல்லிடுவேன், இப்படி வேண்டா வெறுப்பாக போட்டுட்டா எதுவுமே வேலை செய்யாது. ஏதோ ஒரு நம்பிக்கையாக அது நல்லது செய்கிறாங்க, நம்பிக்கையாக போட்டுட்டாங்க. அதெல்லாம் இப்போ நம்ம எங்கே சொல்கிறோம்? நாங்கள் ரேண்டமைஸ்ட் டபுள் பிளைண்ட் கண்ட்ரோல் ட்ரையல். நீ இன்சுலின் தெரியாமல் போட்டாலும் வேலை செய்யணும், தெரிஞ்சு போட்டாலும் வேலை செய்யணும். நீ என்ன படிக்கிறேன்னே தெரியாமல் படித்தாலும் மார்க் வாங்கணும், தெரியாமல் படித்தாலும் வாங்கணும், தெரிஞ்சு படித்தாலும் வாங்கணும். எப்படி வரும்? தெரிஞ்சு ஒழுங்காக படித்தா தானே மார்க் வரும். அதனால் சம்டைம்ஸ் வி ஆர் நாட் யூஸிங் காமன் சென்ஸ் இன் த நேம் ஆஃப் எவிடன்ஸ் பேஸ்ட் மெடிசன். I think I have given more thoughts to ponder than actually answering some of your questions. Thank you.
It's very nice.
Madam, denervation hypersensitivity. எங்க endocrinology அந்த பிரின்சிபல் நாங்கள் வேற மாதிரி பண்ணுவோம் மேடம். ஃபார் எக்ஸாம்பிள், எனி டெஃபிஷியன்சி ஆஃப் அ ஹார்மோன் will actually upregulate the receptors of the hormone. That's well known. நீங்கள் இது எந்த கான்டெக்ட்ல கேட்குறீங்க? கார்டிசால்ல கேட்குறீங்க, கரெக்டா? நர்வ்லையா? நர்வஸ் டிசார்டர்ஸ் நர்வ்லையும் அதே தானே. சி நர்வும் அல்டிமேட்லி அந்த நர்வ் எண்டிங்கில் இட் இஸ் அ நியூரோ டிரான்ஸ்மிட்டர், நோ. ஸோ வென் த நர்வ் இஸ் டினர்வேட்டட், the receptors for the neurotransmitter on the other side, the synapse or other side or whatever the other side, the neuromuscular irukkalam illa neuronal synapse irukkalam, it will be upregulated. Yes, it will be upregulated. No. அது I'm sure you will know this, if my understanding is correct. நீங்கள் கேட்குறது கரெக்டு. Whenever there is an acute injury, see, that's why we do physiotherapy, passive physiotherapy. It's a very common misconception among our patients also. Physiotherapy na அந்த முதல் 10 நாளைக்கு அந்த அவங்க வந்து இப்படி நல்லா அதுக்கப்புறம் அவங்க வந்து எழுதி கொடுத்துட்டு போயிடுவான், இதெல்லாம் நீங்கள் 10 ரிப்பீட்ஸ் பண்ணுங்க. அதை பண்ண மாட்டோம். அது ஆக்டிவாக பண்ணுறது தான் physiotherapy. அவன் முதல்ல பண்ணுறதெல்லாம் just to not make your muscle. Even passive physiotherapy helps in not making the muscle go into disuse. You are right. The local, I'm sure you are physiologist, you should correct me. There are not only this, the spinal arc, you have local intra muscle also has some, even without the nerve also, if you going on working the muscle, there will be some health maintained in the muscle. Am I right? Partly right. There is what mechanism, gamma motor, what is it? You cut the nerve also, the muscle will not go. It will not die, That concept is applying. What you are saying is correct. That's what they are applying. Without knowing also, that's what you are doing. The neonatologist, my friend did one small study in ICH when he was there, is, the massage பண்றாங்கல்ல, the people with the cerebral palsy babies, when you do massage, that babies thrive well. அதுக்கு ஏதோ ஒரு பர்டிகுலர் ஏதோ ஒரு அது ஸ்டடிக்கு ஏதோ பண்ணா, ஐ டோன்ட் ரிமெம்பர் எக்ஸாக்ட்லி, பட் யூ மூவ் த பேபி வெல், யூ மசாஜ் த பேபி வெல். Massage babies are thriving better than this simple in the action. Animals do it. When the newborn calf or whatever of that baby of that animal is not moving, no, you should see that mother. It will be kicking the baby, it will be licking several times, it will be shaking too many times. Something the reticular activating, I don't know what some system works there. I think we should observe all this and maybe apply it in our day-to-day thing for both us. So always be on the move, don't be static. Thank you.
That was one amazing session, sir. So huge thanks to you for that again. I now call upon Dr. Kannan, sir, along with Dr. Pavan, sir, to felicitate both the speaker and the chairperson of the session. Check. To commence the inauguration ceremony, I now call upon Dr. Deepika to render the invocation song. Sir is not coming. You will speak. To formally address the gathering, I now call upon Dr. Pavan, sir, to welcome the gathering.
Good morning to one and all gathered here in person as well as online. So, as the theme of the conference, a biochemical approach to healthy aging. So first and foremost, let me start with saying that from the time I walked from here to here, I have aged, and all of you have aged. And most probably our department has aged a lot over the last 2 weeks in organizing this conference and making sure this conference happens properly in the first place. And those who have watched the match yesterday for the last 15 hours, I think would have aged even more than any of us because of the tension and all those things. And this conference aims at providing those insights which can help or slow down that aging process, and we have chosen the theme for the same in the first place because all of us would like to have a healthy telomere which is in its proper length rather than shortening over a period of time, especially because of the stress and whatnot all we do over a period of time, especially with our late night seeing the phone till 2 a.m. and sleeping and all those things. And I hope this conference provides us with that knowledge where we can implement to our patients as well as in advancing the research which helps towards healthy aging. As Amira said or quoted about Abraham Lincoln saying about let us add life to our years rather than years to our life, and I hope this conference will provide us with that. Thank you.
Thank you so much, sir. ready? May I kindly request the audience to rise for the invocation song, please?
श्रीमहागणपतिरवतु मां श्रीमहागणपतिरवतु मां श्रीमहागणपतिरवतु मां शीतिविनायको मातङ्कमुख श्रीमहागणपतिरवतु मां कामजनकवितीन्द्रसन्नुत कमलालया तटनिवास कामजनकवितीन्द्रसन्नुत कमलालया तटनिवास कोमलतर पल्लव पथकर गुरुगुहाग्रज शिवात्मज कोमलतर पल्लव पथकर गुरुगुहाग्रज शिवात्मज पमदिमिरिकमतन कुजं निसरि किट तपनिस जनुत निसरिम तगणं मगम सनिस पापमदिमित मपनि पकिट दिन निसरि कुकुंतरि मपनि किट तजम रिगमतदिमितर निसरि स कुकुंतरि पनि पसदिमितर रिगमरिस जम तरित सानि पमत दिंगिन तो पमदिमिरिगमतन कुजं निसरि किट तपनि स जनुत निसरि मतगणं मगम सनि स पापमदिमित मपनि पकिटदि पनि सरि कुकुंतरि मपनि किट तजम रिगमतदिमितर निसरि स कुकुंतरि पनि पसदिमितर रिगमरिस जम तरित सानि पमत दिंगिन तुम श्री महागणपतिरवतु सिद्धिविनायको मातङ्कमुख श्रीमहागणपतिरवतु मां. Thank you.
Thank you so much, Deepika, for such melodious and soulful invocation. I now invite Dr. Kannan sir, Dr. Sriram sir, Dr. Akila ma'am, Dr. Panimati ma'am, along with Dr. Kedari ma'am, to the floor to light the Kuttuvilakku, symbolizing the spelling of ignorance and the illumination of knowledge. And Rama Devi ma'am, can you please join them?
A small comment, if I can make. Even the invocation song, I don't know, that girl sang very nicely. She was feeling breathless. It's on Lord Ganapati, who is apparently obese, you all know that. But this is a Jati, you know, he is dancing. So that's also for movement, dance, weight loss, up and down.
With that mood set, I now call upon Dr. Kannan sir to address the gathering.
Good morning to one and all. It's a pleasant morning. So I thank the management and Chancellor sir, Vice Chancellor and Pro Chancellor sir for providing us the entire facilities for arranging the conference. And I congratulate the Biochemistry department for arranging the wonderful program. Actually, I just want to tell only one thing. Everybody is getting aging. Whether we are aware or not, many of us are not aware that we are getting aged. The concept, suppose for example, we are treating the patient like Sriram sir told, all of us are getting aging and it is inevitable. The problem is many of us don't accept that we are getting aged. For example, we celebrate our birthdays many times, but we cut cakes, but we are not aware that we are getting aged. We are getting sarcopenia, we are getting osteopenia, we are getting everything. We are getting NCDs, non-communicable diseases. So the concept of aging, the new concept is, we tell our patient, the aging should be very healthy. Our aging should be very healthy. We have to take precautions for making our life better. We should live better and we should make our patients also to live better. Like sir told, we treat patients' symptoms and we treat patients' problems rather than we treat the lab values. Many of us treat the lab values. For example, many patients, like some of them ask the question, suppose some deficiency is there in the lab test. For example, they bring lot of health checkup reports. They bring a big file, complete checkup, 10,000 rupees package, 5,000 rupees package and all they bring. I think sir will agree and all the practitioners will agree. Many tests are abnormal. They themselves will read the abnormal results. They underline and they ask for treatment. Suppose I want to treat everything, it is not practically possible. Whatever symptoms are there, we have to treat. We have to decide according to the symptoms and according to the thing. And we tell everybody that we should live healthily, we should follow the healthy lifestyle habits. I tell all the youngsters, we should follow that healthy lifestyle and we should educate our youngsters, our friends, our relatives, our old people, our relatives. Then only we can treat our patients in a better manner. For example, the concept of living is prevention is better than cure, and aging should be very healthy and we should lead a healthy life and India should become a model for that. That is what I want to say to all the youngsters. I think all the points have been covered already. I thank once again for the golden opportunity and wish you all a happy and pleasant day and happy learning. Thank you.
Thank you so much, sir, for your warm and welcoming words. They truly set the stage for today's scientific discussions. To formally express our gratitude to everyone who made this conference possible, I now invite Dr. Mervyn Ma'am, Associate Professor, to deliver the word of thanks.
Good morning, everyone. It's my great honor and privilege to propose the vote of thanks for this international conference on SAAGECON-2026, a biochemical approach to healthy aging. First and foremost, I express my sincere gratitude to our esteemed Chancellor, sir, for the constant encouragement, visionary leadership, and unwavering support that made this conference possible. I would like to extend my heartfelt thanks to our respected Pro-Chancellor, sir, for the continuous support and motivation. The guidance has been instrumental in the successful organization of this conference. I would also like to express my sincere appreciation to our beloved Dean Madam and Vice Principal Sir for the valuable guidance and encouragement throughout the planning and execution of this conference. I extend my deep appreciation to all the distinguished speakers and the moderators for having graciously agreed to share your valuable knowledge and insights on healthy aging. A special note of thanks to the TNMC Observer for the gracious presence and support during this conference. I would also like to thank all the faculty members and delegates whose participation and active involvement add a great value to this academic gathering. A big thank you to the technical staff, IT department, maintenance team, and electricity department for your seamless support behind the scenes, ensuring the smooth conduct of this event. Finally, I express my gratitude to Almighty for His blessings, which help us to conduct this conference. Once again, I thank each and every one of you for being part of this memorable moment. Let us continue to collaborate and contribute to the advancement of biochemistry. Thank you.
Thank you so much, ma'am. Refreshments have been arranged right outside the hall. So let's break for tea and reconvene shortly for the next session. I repeat, refreshments have been arranged right outside the hall. So let's break for tea and come back later for the next session. Thank you so much.
Full screen, ma'am. The presentation. Yes, thank you.
Is it okay? Yeah. Okay, thank you.
Hello?
I'll start.
வெளில போய் சொல்றேன்.
Guna sir, I'll leave you He's telling. Start.
Ma'am,
Yes, yes.
you can start presenting now.
Oh, okay. Yeah.
Thank you.
Oh, okay. Thank you very much.
Good morning, ma'am. கட் ஆயிடுச்சு. ஒரே நிமிஷம் மேம், கேட்காத நம்ம பேச. சரி, அதுக்குள்ள will give the introduction and all. அதுக்குள்ள will. Welcome back all. With those yummy samosas and a very strong chai in our belly, we'll happily resume with the next part of the session. In recent years, aging research has opened up many fascinating areas, especially in understanding cellular senescence and how it influences the aging process. Our next speaker will be joining us all the way from Indonesia through the online portal and will be sharing insights on pharmacological targeting of senescence with herbal senolytic agents. To invite the chairperson, I now call upon Dr. Anu Akshara. Over to you.
A very good morning and thank you one and all for joining us today at this amazing conference. It's my privilege to introduce the chairperson, Dr. R. Panimadi, Professor and Head of the Department of Biochemistry, Government Keelpark Medical College. Ma'am has completed her MBBS and DCH from Tanjore Medical College and her MD in Biochemistry from Stanley Medical College. Ma'am has 30 years of overall experience.
Sorry. Hello. Sorry. Yeah. Hello.
Ma'am
Hello.
has 30.
Everyone can hear me? Hello. Yeah, hello. Okay, I assume that everyone can hear me. So if someone cannot hear me, please text me, yeah, or using chat, yeah. Okay. Good afternoon to everyone. I'm Wawai Muli. I'm coming from Jakarta. So all the colleagues, professors, researchers, and guests at Saveetha Anti-Aging Conference 2026. It is an honor to have a chance to present here. My name is Wawai Muli Ahroza, and I'm representative of Department Pharmacology and Therapeutic of the Faculty of Medicine, University of Indonesia. First of all, I would like to thanks to the committee that invite me to this valuable meeting. So actually last year I am coming to Saveetha Medical College, and then it is very excellent institute. Hopefully you can also, all of you, maybe someone can also come to Indonesia to have a collaboration with our institute. Yeah, hello. Is it okay? Hello.
Yes, ma'am, it is audible to every one of us, ma'am. You can continue the presentation.
So I can continue?
Yes, ma'am.
Hello?
Yes, ma'am.
Oh, okay, thank you very much.
Yes,
Yeah.
ma'am.
Okay.
Thank
Yeah.
you.
Yeah. Yes. So actually, I'm happy that I can come to this conference by online. But hopefully, we can have collaboration with all institute in India and with Indonesian university. Yeah, so first of all, I would like to briefly introduce with you our Faculty of Medicine, Universitas Indonesia. So this is the reputation of University of Indonesia. Actually, University of Indonesia is #1 university in Indonesia. So based on the QS World Ranking, it is about 189, and then based on Asian University Ranking, it is in 46. Yeah. And according to the medicine major, our Faculty of Medicine is in the rank of 200 until 250. Yeah. So in University of Indonesia, we have total about in the Faculty of Medicine, Universities of Indonesia, we have total number of students about 5,200. Yeah, student. It is consists of undergraduate medical doctor program, and then we also have master program, doctoral program, subspecialist program, and specialist program. Yeah. So this is the study. So actually, we total have 53 study program consists of undergraduate. Yeah. So we have two kind of program for undergraduate for medical school, medical doctor program, and international class. So we also have we also invite international student from other country to study medical in our university. And then for the postgraduate program, we have 4 master program and doctoral program. And then we also have many specialist education and subspecialist education for the residents. Yeah, the total number of the academic staff in our faculty is about 632, and then we have a lot of professor also. Yeah, now I would like to share my presentation. Yeah, about the topic about the aging. Yeah. To the 3 areas, yeah, that will begin by mapping the landscape of cellular senescence, its pathway and regulation. Then we will look at the current pharmacological intervention. The heart of our discussion will focus on the herbal compounds, specifically the insight we have gathered from the Centella asiatica and our Moringa oleifera. Hello. Can you, see my slide? Oh. Okay. Wait. Yeah. Okay. Is it clear now? Yeah. Yeah, so now we would like to start with the landscape of cellular senescence from pathway, regulation, and function. To understand the solution, we must first understand the problem. What is the senescence? Senescence is a natural biological process where a normal cell essentially loses its ability to proliferate. Unlike apoptosis, where the cell dies, a senescent cell remains metabolically active but permanently exits the cell cycle. It is a highly stable state of cell cycle arrest, often triggered as a protective response to various stressors. When a cell detects a significant damage, it enters state to prevent the replication. So this is the history of senescence. We know that the history of this field takes us back to 1960 and the discovery of the Hayflick limit. We know that Leonard Hayflick observed that the human cells have a finite capacity for division. Once they reach this limit, they become senescent. This is why our first clue that aging is progress. Cellular senescence has both clear pathological and beneficial functions. The pathological consequence involve in replication arrest, altered metabolism, loss of plasticity, and reduced stiffness. However, its beneficial functions are equally important, which include tissue and organ regeneration, homeostasis, embryonic organogenesis, and also tumor suppression. Now, we would like to see the triggers of the senescence. The primary triggers for senescence include nuclear DNA damage, telomere shortening, and oncogene activation. When nuclear DNA is damaged, it activates the DNA damage response or DDR cascade. The signaling pathway ultimately converts with p53 activation, leading to cell cycle arrest. It is the prolonged activation of this DDR that triggers the senescence state. Similarly, oncogene activation can also induce hyperproliferation and replication stress, which results in DNA damage at telomeres. Once a cell becomes senescent, it exhibits several key physical and chemical features. These include a stable cell cycle arrest driven by the upregulation of P21 and P16 inhibitors. Senescent cells also have increased oxidative damage detected by a higher ROS level and an upregulation of anti-apoptotic protein from the BCL2 family, which makes the cell highly resistant to apoptosis. Finally, senescent cells also undergo significant metabolic change characterized by the accumulation of SA-beta-galactoside, the formation of senescent-associated heterochromatin foci or SAHF, and the development of senescent-associated secretory phenotype or SESP. So next, we would like to look at the SESP regulation. This is kind of a dynamic process that accompanies cell cycle exit. This regulation is driven by 5 main mechanisms. First is the core program, which involves in the secretion of pro-inflammatory cytokines like interleukin-6 and interleukin-8, as well as extracellular matrix enzymes such as MMPs. And then the second is the signaling hub, where ATM and P38MAPK drive NF-kappa B to activate SASP genes. And then third is the translational boost, where the mTOR pathway increase the production of interleukin-1 alpha. Fourth is the epigenetic switch. Here, BRD4 activate the SASP expression, while PRC2 acts as a repressor. Fifth is the DNA sensing, that where CGAS-STING detects systolic DNA to trigger inflammatory response. Yeah, so this is the step of the SASP regulation, core program, and then signaling hub, and then the translational boost, and next is the epigenetic switch, and finally DNA sensing. Next, we would like to discuss the biological consequence of cell senescence, which can have both beneficial and detrimental effects depending on the context. For the beneficial impacts, the function include development and healing process. Senescent cells guide embryonic growth through the secretion of FGF4 and FGF8, shape placental structure with MMP2 and MMP9, and promote wound healing via PDGF-AA secretion. Secondly, senescence also can be utilized as a tumor suppressor. Senescence blocks cancer progression by halting the cell cycle through P53, P16, and P21, and signals surrounding cells through the secretion of interleukin-6 and interleukin-8. On the other hand, there is some detrimental impacts. One of them is inflammation, as ASP components can be trigger chronic inflammation and create a microenvironment that can actually support tumor development. Next, senescence can also reduce regenerative capacity because senescence can increase P16 and P21 expression, leading to stem cell exhaustion, thereby limiting the ability of tissue to repair themselves. Senescence also can impact the cellular reprogramming due to interleukin-6, which can trigger cells to return to an embryonic-like state. While this can balance tissue regeneration, it simultaneously increases the risk of tumor. Now, I would like to share with you the current pharmacological intervention aimed at the senescent cell. This is an overview of the therapeutics to eliminate senescent cell. Senolytic approach is based on the expression of specific markers expressed in the cytoplasma or at the plasma membrane of the senescent cell. Several therapies have been developed, such as pharmacological inhibitors and antibody drug conjugated or CAR T cell, and display different mechanism of action. As you can see here, there are many possible pharmacotherapy agents like BCL2 inhibitor, navitoclax, venetoclax, yeah, and then tyrosine kinase inhibitor like dasatinib. I think this kind of inhibitor is already past the clinical trial. And then from the heart medicine, there are some research about the flavonoid polyphenol, for example, like fisetin and quercetin. And then the other agent is HSP inhibitor and P53 inhibitor. Okay, this table is a list of senolytic drugs and their potential use in age-related disease. Currently, most of them are still in clinical trial phase. Yeah, most of this kind of agent is not complete the clinical trial until phase 3. So it means that no available senolytic agent already in the market, especially in Indonesia. I'm not sure in India. Yeah. Okay. Now we would like to move to the analysis how senescence can be used for the cancer therapy. We know that various cancer therapies such as chemotherapy, radiotherapy, and specific inhibitor can induce senescence through the interdependent pathway. Persistent DNA damage and the direct inhibition of CDK activate P53 and P21, which ultimately reinforce one another to trigger stable cell cycle arrest and the primary senescence phenotype, including P16 upregulation, beta-galactosidase activation, and SAAGE production. The senescence is also implemented in several vaccine and immunological approach. The activation of or modulation of the immune system can also trigger the recognition and the elimination of the senescent cell. So this is already published in 2024 that the vaccine and immunological approach also can be used for the elimination and recognition of the senescent cells. Now, I would like to share with you the herbal compound that associated with the senescence treatment. Yeah, I mean, this is the major topic of my presentation. Yeah, this is the common research area for cellular senescence and the related nutritional intervention. Many cells models are used to study cellular senescence, and the most widely used are cell models are endothelial cells, fibroblasts, muscle cell, and nerve cell models. A variety of plant extracts with effective anti-aging property have been identified. Many herbal extracts exhibit anti-aging effect. Natural nutritional intervention for cellular senescence mainly include carbohydrate, polyphenol, peptide, steroid compounds, and vitamin. So as you can see here, there are some herb medicine that can be used for a specific area of the senescence. For example, for endothelium protection, the resveratrol, curcumin, salicin, quercetin, and then for neuroprotection, so some catechin, Rhizum barbarum, and then for myocyte protection, resveratrol, for example, and then fibroblast protection, resveratrol, curcumin, vitamin C, and so on. In addition, several herbals also have the ability to affect the mitochondria by reducing the mitochondrial disorder and DNA damage. So you can see that some herbal medicine, So, for example, like giant knotweed rhizome, and then Radix astragali, and then Radix blueberry, and then also Chinese ginseng. There are several pathways that can be utilized for antisenescence herbal drugs research. First is the modulation of telomere activity. Several herbal drugs are proven to interfere with the p53, AKT, and also mTOR pathway. In addition, several herbals also have ability to affect the mitochondria by reducing the mitochondrial disorder and DNA damage. And also some herbal medicine also have potential to affecting by the inhibit the oxidative stress response. Herbal drugs also have the ability to affect the inflammatory response by reducing the oxidative stress. Now I would like to share with you the herbal compound associated with the senescence treatment. This is the insight from our study. We currently using some herbal medicine to check, to explore whether they have the anti-senolytic agent. One of the herbal medicine that we interest is Centella asiatica. Centella asiatica has become a rising star in Indonesian anti-aging skincare. This traditional plant is shared across different culture. If I'm not mistaken, in India, it is known as Mandu Kaparni or Gotukola, and is widely used in Ayurvedic medicine as a rasayana or a rejuvenative herb. Meanwhile, in Indonesia, we locally know it is the name is Pegagan. It is already published as a meta-analysis by Concave et al. It is highlighted. It is that have a clinical efficacy showing that Centella asiatica significantly improve both lip and periocular wrinkles. The study even suggested that it has the potential to replace retinoid in the future, provided that its long-term use is safety is fully established and the Centella asiatica formulation is properly standardized. Centella asiatica contains key active compounds including acetic acid, acetylglycoside, medicated acid, and medicazoid. First of all, mitochondria dysfunction is closely linked to neuroinflammation, aging, and neurodegenerative disease. Centella asiatica exerts antioxidative and mitoprotective effects to counter this. It specifically targets to the NRF2 and SIRT1 signaling pathway, along with NRF3 expression. Furthermore, it preserves mitochondrial complex I activity and mitochondrial membrane potential. By reducing the inflammation and restoring functional mitochondria, Centella asiatica increases the neuronal survival. Ultimately, this neuroprotective benefit could potentially be harnessed to treat and neurodegenerative disease as well as improve functional behavior outcome. Yeah, this is the published paper about our research. So we focus on the extract of Centella Centella asiatica to improve yeah. So yeah, sorry for disturbance. Yeah, okay. So yeah, so this is our published paper related to the Centella asiatica. This paper targeted Centella asiatica to senescence associated with metabolic dysfunction by targeting the inflammation in adipose tissue and macrophage. Our study used ethanol extract of Centella asiatica in high-fat, high-fructose in mice. We used several parameters to see the anti-senescence effect of Centella asiatica, such as body weight, and then adipose tissue weight, and insulin and glucose tolerance test. And we also check some RT-PCR marker for senescence marker, and then we check also histopathology and the staining of SA beta gal. Yeah, so this is the result of the body weight and the total amount of white adipose tissue, and this is the histopathological pattern of the white adipose tissue. So as you can see here that after treated the mice with the high-fat diet, so the mesenteric white adipose tissue become increased, as well as also in the peritoneal white adipose tissue, it is increased by high-fat diet. And then after treatment with Centella asiatica in the different dose, the volume of the adipose tissue become decreased. And then this is the result of the senescence marker. So as you can see here in the SA beta gal staining, the high-fat, high-fructose group of mice exhibit a greenish blue coloration of the fat following SA beta galactoside staining. This greenish blue color appears to diminish in the high-fat, high-fructose group and with Centella administration. SA beta gal galactose activity also elevated in a high-fat, high-fructose diet. However, this activity decreased when the diet includes the Centella. This also applies to the mRNA level of CDKN21 and 1-alpha. So the conclusion of our study is that Centella asiatica show anti-senescence effect in obesity-induced insulin resistance by preventing senescence induction with white adipose tissue of an obesity rodent model. This phenomenon effectively improves systemic insulin sensitivity and further suppress the M1 pro-inflammatory macrophage-induced inflammation. This finding highlight the role of Centella asiatica as a promising medicinal compound treatment for obesity-related metabolic disorder. And then we move to the Moringa olivera. that also we are interested because of maybe they also have the potential anti-senescent effect. Moringa oleifera is also traditionally utilized plant. In India, it is referred as to drumstick, while in Indonesia, it is known as a daun kelor. Moringa has several traditional applications for various illness, including the use of leaves for hepatoprotection and the bark for the antibacterial purpose and so on. So as you can see here, many of part of the moringa can be used, like the leaf and then flower, roots, and then the fruit, the seed and also the bark. There are various pharmacological properties of Moringa oleifera, including antioxidant, anti-cancer, antibacterial, and also anti-diabetic. I would like to present our research on Moringa oleifera as an agent of anti-senescence. In our study, we use two kinds of preparation of Moringa, leaf water extract and the seed oil, resulting in a 4 group of mice. Several parameters were utilized, including body weight, and then also we check the cognitive function using Y-maze and NOR test, and then we check some neurotropic factor, BDNF, and specifically, we also check the senescence marker, P16 and P21, and also SAAGECON test. So this is the result of the cognitive function parameter. So as you can see here in NOR test, novel object recognition test, in HFFD mice, the percentage of investigation in the novel object is become decreased, compared with the normal control. And then treatment with Moringa oleifera, both in the oil formulation or in the extract of the leaf, increase the cognitive function by NOR test. Similarly, also we check by Y-maze. So you can see that treatment with the oil and also with the extract of the leaf can improve the cognitive function and or memory function of the mice. And we check some mRNA level of the senescence marker. We check the BDNF. Our study found a reduction in BDNF expression in the high-fat, high-fructose group, which was ameliorated by administering with Moringa oleifera in both formulation. And our study also found that P16 and P21 mRNA expression was elevated in high-fat, high-fructose group, indicating senescence process. It appears that senescence process can be mitigated by administering the Moringa in also both formulation. The SAAGECON test also revealed that greenish-blue color distinction in the high-fat, high-diet group. This result demonstrated that beta-galactoside activity increased the HEFN group, and then after the treatment with the Moringa oleifera, the greenish-blue become reduced. So this is the conclusion of this study based on the cognitive test, NOR test and Y-maze test. Moringa oleifera in the form of oil and in the form of extract of the leaf improve the memory impairment of HFFD mice, and this outcome could be due to the inhibition of the senescence process, leading to the enhancement in several senescence markers, including BDNF, P16, P21, and beta-galactoside activity. Particularly, compared with the two formulation, the MOO is a little bit better than the MOA. So I think this is the final stage of my final slide of my presentation. So the cellular senescence represents a complex biological phenomenon characterized by various driving mechanisms, suggested that multi-target herbal compounds may serve as effective anti-senescent agents. Preclinical evidence underscore the potential of traditional plants, including Centella asiatica and Moringa oleifera, in addressing metabolic and memory impairment associated with the senescence. In the future, we have to do the comprehensive investigation, including in vitro, in vivo, and also finally clinical trials are essential to validate their therapeutic efficacy. Yeah, thank you very much for your attention.
Thank you so much, ma'am. Thank you so much, ma'am. Your talk gave us a deeper understanding of how herbal senolytic agents may open up various avenues in the field of healthy aging. We truly appreciate your presence and your contribution today, ma'am. Before we move to the question and answer session, I would like to call upon Dr. Anu Akshara to introduce the chairperson of the session, which was missed earlier because of some technical issues. I deeply regret the inconvenience. Over to you, Anu.
A very good morning and thank you one and all for joining us today at this amazing conference. It's my privilege to introduce the chairperson, Dr. R. Panimadi, Professor and Head of the Department of Biochemistry, Government Keelpark Medical College. Ma'am has completed her MBBS and DCH from Tanjavur Medical College and her MD in Biochemistry from Stanley Medical College. Ma'am has 30 years of overall experience, including 16 years of teaching experience in the DME sector. Ma'am has received an award from the District Collector in 2022 for her dedicated service. She has presented papers in 2 international and 10 national conferences, guided ICMR projects, and actively contributes to curriculum development and medical education training programs. She is a Board of Studies member at the Tamil Nadu Dr. MGR Medical University. She is also a life member of Indian Academy of Pediatrics and the Association of Clinical Biochemists of India. On behalf of the entire Biochemistry department, I extend my warmest welcome to you, ma'am. Over to you, ma'am.
Happy morning to one and all. It's going to be happy afternoon. And first of all, I thank respected Professor Dr. Anandi ma'am for inviting me for this occasion, and thank you so much, ma'am. And best wishes for the whole team of Biochemistry of Saveetha Medical College for organizing this conference a very good and grand manner. And I'm going to introduce Vavamuli Arozol ma'am. Ma'am, good afternoon, ma'am. I think it's also good afternoon in Indonesia.
Good afternoon. Good afternoon.
Yes, ma'am. Ma'am, actually, madam is the professor and head of the Department Faculty of Medicine, University of Indonesia. And formerly, she was the head of Department of Pharmacology and Therapeutics until 2021. And she's been an expert committee member of FDA Indonesia National Pharmacovigilance Program. And she has got her MD from the University of Indonesia and PhD from Niigata University of Pharmacy and Applied Life Science, Japan in 2011. And she is an expertise in cardiovascular research, neuropharmacology, pharmacodynamics, clinical trials, drug utilization studies, and she is the principal co-investigator in Karkuraj for heart failure study, therapeutic effects of andrographic spanniculata, substitution therapies for drug-resistant epilepsy. And she has around 87 scientific publications to her credit. She has contributed to 10 book chapters, and there are around 1,739 Google Scholars citations. And there are supervised 48 scholars under her leadership, and she is now the associate editor of Frontiers in Pharmacology. Ma'am, actually you enlightened us with all the herbals that can be used in our day-to-day life, and you pointed out about moringa, that drumstick leaves, which is very well available in India also, ma'am.
And an apple a day keeps the doctor away. Just like that, apple, strawberry, all the berries, raspberries, we are getting in India also. They all have the senolytic properties, so that this physiological property of tumor suppression and wound healing will be enhanced by all these senolytic agents. Thank you so much, ma'am, for your very informative and you made us to be active participant of your talk. Thank you so much, ma'am.
Yeah, thank you again. Thank you very much. Bye bye.
Thank you so much, ma'am. The forum is now open for discussion. If you have any questions for Baba Muli ma'am, you can shoot your shot. Any questions?
See, actually, முன்னெல்லாம் வந்து மஞ்சள் போடுவாங்க எல்லாரும். மஞ்சள் வந்து it will reduce the aging factor. இப்போலாம் நம்ம யாரும் போடுறதே இல்லை. But whatever beauty cosmetics we use for facial thing and all, it contains more of this curcumin, apple, papaya and everything. என்னன்னா காசை கொடுத்து நம்ம வாங்குறோம். Better we use it in a natural way.
Thank you so much, ma'am. I now call upon Dr. Kedari ma'am to felicitate the chairperson of the session.
So I cannot hear you clearly. Would you like to text by?
Sorry, ma'am, I didn't get you, ma'am.
Yeah, so please someone can text me in private, yeah, because of I cannot hear clearly. I mean, what is the question? Yes, yes.
Just a minute. Yeah. Okay, now with that we are moving to the next section. To lead us through the today's exploration of critical subject, we are now privileged to have Dr. Rama Devi, and who will be delivering an expert talk on the topic biomarkers of aging. To formally invite and welcome the distinguished chairperson who will be guiding the session, I now request Mr. Sundareshan to come forward.
It is my distinct honor to welcome Professor Dr. P.M. Abraham Samrabjan to podium today. He is currently working as a consultant, clinical lead for biochemistry and a quality manager of the Central Clinical Laboratory Services at Dr. Hella Institute and Medical Center in Chennai. Sir has over 19 years of clinical laboratory experience. To name a few of his achievements, Sir is a certified NABL technical assessor. Through his meticulous planning, his team achieved zero non-conformance as an assessee during rigorous accreditation for NABH, JCI and NABL standards. Sir has served as an interim HOD and quality manager at MGM Healthcare during COVID-19 pandemic, where he successfully led the laboratory to enable accreditation for RT-PCR testing. He is also a board member for Roche Diagnostic India Private Limited and a member of the National Advisory Board Limited for 10th edition of Textbook of Biochemistry for medical students by Dr. Vasudevan. We are honored to have him as a moderator for the upcoming session. I would like to call Dr. Abraham Samrabjan to introduce the speaker for the next session. Over to you, sir.
Thank you, Sundareshan, for the introduction. Actually, little bit a time of emotions for me, because this is the place where I started my career as a AP and gone through my full career till I got my title as professor. So this place gives me a lot of memory, which is very nostalgic to me. I'm very thankful first to Dr. Anandi Madam, Pavan Kumar, and Dr. Kedari, Mervin. They were all worked together for nearly more than 10 years in this institute, and really honored to be on this conference. And it's my honor to introduce the prominent, eminent speaker, Dr. Ramadevi ma'am, a teacher and administrator with an experience of nearly 35 years in both academics and clinical in the discipline of biochemistry. Madam has graduated both MBBS and MD Biochemistry from the prestigious Madras Medical College, Chennai, PhD from MGR Medical University, Chennai, and to add to the qualification, Madam has got a PG in Hospital Management, MHFW from New Delhi. Madam has got rich teaching experience for nearly 30 years, teaching students of both medical and paramedical courses in various medical colleges in Tamil Nadu. Clinical experience in managing the clinical biochemistry labs of tertiary care hospitals attached to the medical colleges. As an administrator, Madam was the director and professor of biochemistry in Madras Medical College and Rajiv Gandhi Government Hospital, General Hospital for a period of 9 years, managing the equipment purchase at state level in coordination with the TNMSC. And Madam was also in the academic policy decision makings for Medical University and Director of Medical Education and Research. Madam has served as the Dean, Government Villupuram Medical College Hospital, and to add to the credentials, Madam has 35 publications, both national and international, and has delivered more than 40 presentations at both national and international conferences, received many grants and fellowships, both national and international, and Madam was a guide for PG ICMR fellowship and PhD students. Currently, Madam is serving as Professor and Head of Biochemistry at ACS Medical College, Chennai. So with this introduction, I call Dr. Ramadevi ma'am to share the knowledge on biomarkers of aging on this August occasion. Welcome, ma'am.
Look here. Good morning, one and all, and I thank the organizing team, the chancellor, pro-chancellor, and the administrators of this Saveetha Medical University, and the HOD and faculty of the team from the Department of Biochemistry, Saveetha Medical College, for inviting me here for this presentation, and I'm very delighted to present on this topic of aging. As the Dean had earlier mentioned that many of us, right from the time we are born, we know the aging process actually starts. It starts from the time we are born, it increases, and then it reaches a peak, and then there is a decline in the health and the body functions, that is what. So which we call as aging. So I'm very delighted to talk about this, and yeah, I will have a look there. Thank you. Just to have a look. So thank you all for being here, and I thank for the very kind introduction. So let us proceed. I'll start. It's going to be a little interesting, I feel, because so what is age? What is age? We say age. What is the age? So it is a period of life that is measured by years right from birth. So we measure the age from birth, right from birth, that is the period we say. Now what is aging then? Aging is the process of, what would we say, turning old? Aging is the process of every day going on. We could put it in a nicer way. So that is aging. So I'll just have a look this side because it's too high. So it is a progressive decline generally. When we say aging, we just talk only after about, we consider maybe after 50 or so, we say aging process. Because until then, it is, you know, it is in the upward trend. The graph, if you can imagine a graph, so as we age, as we grow and age from birth, there is an increasing trend in the body functions, the activities, in our faculty, everything, it increases. Yeah, thank you. Yeah. So there is an increase, and then after a particular point of time or after a stage, there is a decline or a slow decrease or a decrease in the speed in which an accelerated growth was there. So there it slows down, it plateaus, and then there is a slow decline. So there is aging, we say it is a progressive decline in the physiological functions. In the physiological functions, which is influenced by genetics, biochemical processes, socio-economical status, environmental factors, and also lifestyle. Okay. Yeah. So the molecular architecture of decline. So you have, can I use the mouse or pointer? Okay. Pointer use பண்ணலாமா இதெல்லாம் யூஸ் பண்ணலாமா mouse வருமா அதுல No, it is coming, mouse is coming here. Yeah, I can see. So you have this oxidative stress. Touched, huh? Okay. Yeah, thank you. So you have various factors which are involved in the aging process or the decline of the decline from the youth, you may say. So you have oxidative stress, you have mitochondrial dysfunction, cellular senescence, a lot we heard about senescence already, then telomere shortening, DNA damage and repair, and chronic inflammation. So it is actually a multifactorial interplay of all these factors which contribute to the aging process. So, well, let us see one by one, because we've listened to so much. Well, we'll just go quickly. So, oxidative stress. So, oxidative stress happens all the time, right from every day in all of us. And when it overwhelms the cellular defense mechanisms, it causes damage or it has some deleterious effects. So, the imbalance, there is an imbalance, and aging is driven by an imbalance between the reactive oxygen species production and the body's antioxidant defense mechanisms. So when the body is not able to combat the reactive oxygen species that is being formed, so then it leads to the beginning of the aging process. So at one point of time there is an imbalance. So when we are young and youthful and healthy, the antioxidant systems are on the upper hand, whereas after a plateau, the defense mechanisms are slightly lower, so the oxidant systems or the oxidative stress takes over, and slowly the imbalance, it tilts, and the deleterious effects or the negative effects are being manifested. So in the form of lipid peroxidation, protein oxidation, and DNA damage. The previous one. இதுக்கு முன்னாடி ஒன்று இருந்துச்சுல இதுதானா okay jumped okay yeah. So here you can see the oxidative damage caused by reactive oxygen species. So what happens, the mitochondrial damage may occur, and it involves the protein lipid peroxidation is there, protein degradation is there, and DNA damage to the DNA also, DNA bases also occurs, and all the consequences of this, the functional effects are then manifested as the effect on the system, which results in the manifestation as aging slowly. It's a slow process. Next, please. So aging in, there are membrane alterations, lipid to protein damage, and the damage to the cytoskeleton, and all these results in accumulation of certain aberrant proteins. And that leads to, once they start getting accumulated, that leads to organelle damage, intracellular organelle damage. And once these damages are being pronounced, then it leads to there is a possibility of developing various other complications like malignancies, osteoporosis, dementia, and the neurologically it may contribute to dementia, and atherosclerosis, obesity. All these are the consequences of the effects of the oxidative damage which is caused to various structures inside the cell. Next, please. Next comes the mitochondrial dysfunction and the cellular energy crisis. So what happens when the mitochondria, we know, we have all read that mitochondria is the powerhouse of the cell, and the ATP, it is responsible for ATP generation, and the cells are providing the energy, or the energy for the cellular metabolism is from the mitochondria mainly. So what happens when there is a mitochondrial dysfunction? There is reduced oxidative phosphorylation, increased generation of reactive oxygen species, and accumulation of mutations in the mitochondria. So mitochondrial DNA mutations can also occur because of this mitochondrial damage. Now this is like a bottleneck wherein all these factors together, they will act together and cause a impaired ATP production, which in turn results in reduced cellular energy, triggering of increased apoptosis, and onset of age-related diseases, that is the chronic conditions. Next, please. Now senescence, we heard a lot about senescent cells and the other pharmacological effects. So what are the features of the senescent cells? So senescence is aging, the cellular aging, we call it as senescence. And the characteristics of aged cells or the senescent cells are increased senescence associated beta galactosidase activity. So this enzyme gets increased, so which can be used as a marker actually. You can measure this beta galactosidase, senescence associated beta galactosidase enzymes. And then advanced expression of certain compounds, certain proteins like the P53 also can occur from the cells. Then SASP, senescent associated specific phenotype, and certain protein modifications, accumulation of protein aggregates, lipofussion can be there, decreased turnover mechanisms. So the normal cell functioning is generally affected, and proliferation arrest. So in senescence, the cells failed, after which once the cells reach senescence, there is inability to proliferate. So proliferation arrest occurs. And of course the cells have a difference in morphology, so morphological changes are also seen. So what was a rounded cell, what was a perfect cell? Yeah, the perfect round cell becomes an irreversible cell, it goes into irreversible cell cycle arrest, and the morphology is changed, and then this becomes senescence associated secretory phenotype is, the cells develop a phenotype and it releases, so it is actually a secretome, which they call. These senescent cells together, they form a secretome, and they release certain inflammatory cytokines into the microenvironment. So that becomes a vicious cycle that adds to again further damage or downgrading of the aging process in the cell and in the organism as a whole. Next, please. Now telomeric shortening or telomeric attrition. So what happens that initially it is the telomeres, the shortening of telomeres as the duration progresses. The telomeres get shortened. So the telomeres are the repetitive DNA sequences that protect the chromosome. Now the shortening of the telomeres, that results in loss of protection, and that can lead to DNA damage as well. Next, please. So here you can see that as the years progress, you can see the size of the telomeres. And for example, in 20 years, you can see the green portion is quite thick, whereas when you come down to the 80 years, the green is almost negligible, it is gone. So the senescent cells, the protective capping is gone, and the DNA is likely to be exposed to a lot of damage, and which can result in other further complications as the years go by. Next, please. So what is the role of biomarkers? So these are the processes which are occurring in the aging, during the aging process of an individual, of an organism, of a cell. So what is the role of biomarkers? So first, biomarkers, biological parameters, we need to measure the biological parameters that indicate the actual rate of progression of aging. So the functions of a biomarker is to measure the true biological age, precisely predict disease risk, and to monitor the efficacy of anti-aging interventions. So now we have technology has advanced, a lot of medical science has advanced, therapeutics have advanced, so we have a lot of anti-aging interventions which is possible. And so the biomarkers are very important so that we can assess, it is possible to assess the aging process and initiate appropriate therapeutic measures. So a biomarker, ideal biomarker should be specific, reproducible, it should be non-invasive, it should be clinically relevant. So these are the general characteristics. Next, please. So they can be classified mainly as molecular biomarkers, cellular biomarkers, physiological biomarkers, and composite biomarkers. So the molecular are, you can measure the DNA damage. So measure of DNA damage, telomere length can be measured, then epigenetic markers. So these are the molecular markers. And at the cellular level, you have the senescent cells are getting accumulated. So histopathologically, you can measure, you can look for the presence of cellular cells, because senescent cells, because their morphology is changed, they have a different staining characteristics that I told you. The senescent associated beta galactosidase activity increases, it gives a characteristic blue color on staining. So that can be actually measured, or that can be visualized. And stem cell depletion. So depletion of stem cells means the fresh cells cannot be formed. So all these can be measured. The physiologically, you can measure the blood pressure, the lung function, the function of the various organs, various organ functions, the neurological function, the cognitive function, all these can be measured. And composite is advanced multi-parameter aging clocks are also available. Next, please. So the biochemical signatures of, key signatures of aging. So advanced glycation end products, one can measure. We all know about advanced glycation end products, which is, we especially look for them in chronic conditions like diabetes mellitus. So AGEs, advanced glycation end products, sirtuin proteins can be measured. NAD, nicotinamide adenine dinucleotide levels can be measured. Then clotho, which is an anti-aging protein. So clotho protein can be measured, and growth differentiation factors, GDF11, GDF15, all these can be measured. And of course, inflammatory markers like specifically IL-6, CRP, these are all factors which are associated with aging and chronic conditions. So they can be used as biomarkers for aging. Of course, we also have our routine parameters, blood glucose, lipid profile, the liver function. All these have age-specific levels, especially the liver enzymes, your lipid profiles, they have age-specific levels. So younger levels are different from the age. So that also can be used as biomarkers for the aging, to assess the age. Next, please. See, so many mechanisms for assessing the aging process. So you have molecular and cellular. Yeah. molecular and cellular aging biomarkers like telomere, so just a repetition, telomere length, then omic biomarkers. So various omics, the proteomics, genomics, metabolomics, all these are all the omics. So metabolomics, various metabolites can be measured, and all these are, they may be either biophysical or the blood-based biomarkers. Then, of course, radiological imaging studies can be done, wherein the brain age can be assessed, the retinal age can be assessed, the face age can be assessed, ECG age by using ECG, and others. Certain other measures are also possible. Then the clinical measure-based aging biomarkers are lung age, cognitive age, heart age, biopsychological age. So these are all, there are all means of assessing the age of aging of the individual, or we will not say age, aging of the individual. Composite age markers like frailty test, frailty index, and pace of aging. So all these are all means of assessing the aging process of an individual. Next, please. Thank you. So what is epigenetic clock? So DNA methylation clocks, they track specific chemical modifications on the DNA over a period of time. And pioneering models like the Horvath clock and the Hannum clock, they are available. The clinical advantage is these tools, they provide highly accurate estimations of the biological age, significantly outperforming chronological age in predicting mortality and future disease risk prediction. So what are the multi-omics? You have, I told you, metabolomics, you have proteomics, various study of metabolites in the blood. Proteomics, the study of proteins, the protein changes which may occur over a period of time, and the presence of extracellular vesicles, and gut microbiome. So gut microbiome also is associated with health, and a good gut microbiome helps to maintain the health, and therefore it delays the aging process or delays the deleterious effects that may occur with the aging process, like the reactive oxygen species and the oxidative stress. All that is reduced when the gut microbiome is healthy. So what are the use of these biomarkers? So it helps in the early disease detection, so identifying early disease conditions and quite an early age, so that precise patient risk stratification is possible. And intervention, so when required, some intervention can be initiated. So monitoring the effectiveness of emerging anti-aging therapies. So a lot of therapies are there. So many therapies people are doing, including Botox and all that. So monitoring the effectiveness of emerging anti-aging therapies. And next is future is driving personalized medicine and accelerating drug development in the field of geroscience, gerontology or geroscience. Next, please. The future prospects are so you have cellular senescence, which recognizing it as a spectrum and developing interventions for health, and interdisciplinary collaborations. So convergence of experts. So multidisciplinary approach can be used to help to maintain the youthfulness or to help to prevent the further delay or decreasing the consequences of aging, and using biomarkers, identifying the actual aging process, which is identifying the process which is accelerating the aging process, so that you can introduce interventions, and you can have precision interventions can be made, epigenetic engineering is possible, and with all these put together, and of course with metabolism and aging like caloric restriction, all these various factors can be included to ensure that the aging process is delayed and effective intervention and therapies can be put forward. So these are all the future prospects. So all these interventions help to extend the human health span. So the range of health, having a good health, so that is what is called as health span. So aging is not an inevitable mystery. It is driven by complex but understandable biochemical and molecular mechanisms. And you know that biological aging is now fully quantifiable through specific biomarkers. Several biomarkers are there. And AI-based approaches and multi-omics, all put with a lot of technology, it is possible for us to predict aging and disease. And the ultimate goal will be to understanding this biology is the master key to intervening, fundamentally extending both human health span and lifespan. And the video. அதிலே கிளிக் பண்ண வருமே, அதிலே வருமே பட்டன் இல்லை. Not working, huh? Volume. Sorry, volume is not there. Yeah, sure. Just something interesting. Sorry, the volume was. Many of you would have seen this ad. Podum. Enough, yeah. The music would have made it a little more interesting. It doesn't matter. Please close this. Next slide, next slide. So now what is age? You just saw that ad. What is age? You saw one girl whom everybody was so happy to see, and then a little one calls her mummy, and others are little astonished that this girl who looks like a college student is a mother. So she has not aged. So now what is age? What do you think is age here? Age is, next please. Age is just a number. Okay? So how you feel and live your life is more important. Next please. Thank you.
Okay. Now with that was a very informative session, ma'am, and it has spread a lot of knowledge among us. And the session is open for discussion. If anyone have any doubts, you can ask. I repeat, the session is open for discussion. If anyone have any doubts, you can ask. Okay, with that, now I'm inviting Dr. Gurupavan sir and Dr. Radhakrishnan sir to facilitate the speaker and chairperson. Doubt is there? Yeah, okay, fine. Sorry.
It was a very wonderful lecture that is starting from the chemistry process of aging, from that coming out with the biomarkers, and then the last ad video was it was a very old appreciating video. So let us all follow this and try to take care of our aging, because we are all, many of us are in that aging group only. All of us. So thank you, ma'am. Good day.
Okay, now I am inviting over. Any more questions? Yeah, with that, now I'm inviting Dr. Gurubhavan sir and Radhakrishnan sir to felicitate the speaker and chairperson. Okay, after that, we are now moving on to the next session of the day. This is my pleasure to introduce our esteemed speaker, Dr. Agila Prashant, who will be sharing her insights on the topic decoding aging at molecular level. To invite the chairperson of this session and set the stage for discussion, I call upon Bhuvaneshwari.
Respected dignitaries on the dais, esteemed faculty members and my dear friends, a very good afternoon to everyone present here. I am Bhuvaneshwari T, MSc postgraduate student from the Department of Biochemistry. It gives me immense pleasure and honor to introduce Dr. Soumya ma'am. He is working as a professor and head of the Department of Biochemistry, MEU member, Association Laboratory Director and Phase 1 Director, Sri Ramachandra Medical College. She holds MD and DNB qualification, has over 18 years of academic and clinical experience and is a recognized PhD guide. Her research contributions are remarkable with numerous publications in reputed national and international journals. Her key research interests such as included biomarkers in coronary artery disease, chronic kidney disease, diabetes mellitus, PCSK9 and medical education methodologies. She is also a life member of Association of Medical Biochemists and the Association of Clinical Biochemists of India. I extend a warm welcome to you, ma'am. Over to you, ma'am.
Good afternoon to all of you who have come here. So at the outset, I would like to thank the organizing team and the management of Saveetha Medical College for giving me this honor to be a chairperson, and I'm privileged to be a chairperson for your session, ma'am. And it's my heartfelt thanks to Dr. Anandi ma'am and Pavan and Kedari ma'am and her entire dynamic team who have worked so relentlessly in organizing this program in a success way. So I'm privileged to introduce Dr. Akila Prashant. So for this session, so she has done her MBBS and MD and PhD, and she is a medical biochemist and molecular geneticist who work bridging laboratory science, clinical diagnostic, and translational genomics. She serves as a professor and head of biochemistry at JSS Medical College, JSS Academy of Higher Education and Research, Mysore. Her scientific contributions span over more than 2 decades of work in clinical biochemistry, molecular genetics, and biomarker discovery. She has systematically strengthened the diagnostic ecosystem through the establishment of key laboratories, including the newborn screening for inborn errors of metabolism, FISH, cytogenetics, maternal screening, and more advanced molecular testing platforms in her place. These efforts have enabled early identification of metabolic, chromosomal, and monogenic disorders in regional population, thereby helping in improving the diagnostic access within the public health system. Her works cover rare Mendelian disorders like thalassemia, pharmacogenomics, mitochondrial variants, and genomic approaches in metabolic and neurological diseases. She also leads a capacity building through her role in national programs such as ICMR, Collaborating Center of Excellence, and National Registry of Rare and Other Inherited Disorders. Dr. Akila has authored almost more than 100 scientific publications across various fields of biochemistry. Her work is recognized through multiple awards, including the AMBI Fellowship Award in 2024 and the Research Excellence Award in her institution in 2025, and the APFCB Award for the Global MedLab Week Award in 2025. And she is also listed as top 2% scientist in Stanford in 2024. So beyond research, she has played a pivotal role in shaping academic curricula, mentoring young scientists, and promoting the professional growth of laboratory medicine in India. So without taking more time from my side, I hand over the podium to you, ma'am. We are eagerly waiting for your session. Over to you, ma'am.
Thank you very much for the introduction, ma'am. And at the outset, I would like to thank Dr. Anandi, ma'am, for inviting me here and her entire team for all the hospitality which I'm getting from yesterday. Yeah, my presentation probably would be a lot of overlap with Dr. Ramadevi's presentation because both of us being biochemists, I think we will be talking on the same lines and we are talking about the same topic, so probably there will be a lot of overlaps. So wherever there is overlap, probably I'll move a little faster. Anyway, we are also getting late for lunch also. Okay, so the topic given to me was decoding aging at the molecular level. We have seen what is aging since morning, and all the speakers have highlighted the importance of aging. Yes, it's a progressive decline in the physiological function over time, and it is characterized by reduced cellular repair and hematopoietic capacity because age occurs when the repair mechanisms fail. Okay, it's not only about the time duration, but also there are certain biochemical processes in our body during the process of aging. If there is any failure in any of these processes, this aging occurs. And it's associated with increased vulnerability to diseases and environmental stress factors also. And it's a universal phenomena. It's not just seen in humans, it is seen in all the species. And but the rate varies among individuals, inter-individual variability. You can see Shilpa Shetty and Malaika Arora, how they are, and you know, they are, the way they probably take care of their health is maybe different from how we are taking care of our health. So age is not a disease, but the process of aging can lead to multiple disorders. So there could be certain age-associated diseases. Why we are talking about the process of aging? Because maybe during this process of aging, you come across these disorders, and if at all we're able to tackle the process of aging, maybe these disorders can be handled better. Okay, so there are disorders, well-known disorders, this is not known for anybody, like cardiovascular disease, neurodegenerative disorders, cancer, type 2 diabetes, or any kind of metabolic syndrome. Morning we have seen about bone health and frailty. So all these disorders are kind of a part and parcel of the aging process, okay? So we have seen that as the age advances, a person becomes more at risk for cardiovascular disorders. And this is more in males till the female reaches the age of menopause, and then the risk is same in both males and females. Coming to neurodegenerative disorders also, like for example, Alzheimer's and Parkinson's, they also lead to the cognitive and motor decline. That is also sometimes seen as a part of the aging process. And cancer, we know, again, the cells wherein they fail to repair the damage in them, such cells can become cancerous, and then they multiply without any kind of regulation. So that also leads to the cancerous condition. So all these diseases can be a process involved within the aging system. So in case we understand the aging system better, what the biological processes taking place in the aging, during the process of aging, maybe we can handle these disorders better. So as we have seen, age, it's not same for everyone. I mean, it's not, the process would not be the same for everyone. We have seen the chronological aging and biological aging, what ma'am has told earlier. So chronological aging is just the numbers of years we have lived, but the biological aging is something wherein how the functional status of the cells are, okay, how they are functioning, and that can be varying among different individuals, okay. That is the way we have customized our system, like those lifestyle, the environmental factors, our diet, everything would influence that. Okay, and chronological age, as we know, it is the same for everyone who was born in that particular year, but biological age might vary. And this chronological age may not be a proper predictor of health, but yes, the biological age, it is a better indicator of the disease risk. So depending upon how the cells have aged, or how they have the process which has been there in the cells, whether it is functioning properly, depending upon that, they can tell us whether they are, the person is actually young or aging has set in with that person. So the aging is driven by the molecular and cellular damage accumulation. So whatever damages have occurred during the process of the life, they all accumulate, and if they are not able to clear that accumulation, and that leads to aging. So understanding these mechanisms helps to develop strategies for a healthy longevity. Okay, so that is why we are trying to understand all these molecular mechanisms, because we can know, once better understood, these mechanisms can be handled either by lifestyle modification or by introducing a therapeutic agent. Okay. So why this aging has occurred? So this kind of the process, it has also led to evolutionary processes, that is evolutionary changes what has happened and seen throughout the the life which has existed on the earth. So this is in the process of this evolution, there has been a lot of changes, which mutations or single nucleotide polymorphisms or DNA damages which has occurred. So they all have contributed to the aging process, and aging is shaped by all these evolutionary pressures, which is focused on survival and reproduction. Okay, so early in life, whatever changes are happening, they kind of enhance this reproductive success in life. And if you see throughout our process of evolution, the emphasis more is on reproduction rather than maintaining a healthy cell. So as the species have to survive, they have to reproduce. Okay, so that is why the emphasis is more on reproduction, so that all those changes happen early in life, and all the reproductive cells may not age like how the somatic cells do. Okay, so it is always said that reproduction is prioritized in our system, and long-term maintenance of the cells in the somatic cells may not be that much of prioritized, and that's the reason why the aging process happens. Okay, reproduction would take place during that reproductive age group, and people are healthy most of the time till then. The long-term maintenance of the cells are not that well prioritized, and that's why the aging process happens. So the evolutionary theory is explaining aging as a product of natural selection and shaping the organism's lifespan. So there are several theories. For example, mutation accumulation theory, that is harmful mutations accumulate in the genome, becomes natural selection in, the natural selection is weak in later life. And for example, again, the antagonistic pleiotropy, that is another theory. So genes offering early life advantage can have harmful effects that only appear in later life, contributing to aging. And again, disposal soma theory, this energy is prioritized for reproduction, often at an expense of maintaining non-reproductive cells, leading to their degradation and aging. So to emphasize that, all these theories emphasize that the priority is given more to the reproductive cells rather than the other somatic cells, and that's the reason why all the other somatic cells go through the process of aging. So these theories highlight how evolutionary pressures prioritize reproduction over long-term somatic maintenance, and that's leading to aging. So molecular hallmarks, since I was told to talk about the molecular mechanism, so the most common one is the genome instability. So the cells kind of accumulate DNA damage over time, a primary driver of aging and disease. Okay, so the sources for this damage, very well explained by ma'am. That is reactive oxygen species, that is one of the major source of DNA damage. Replication errors can occur during the cell division, and environmental toxins and radiations are of course there, which can cause this damage to the DNA. So this will be, the damage can be either double-stranded DNA breaks or impaired repair mechanisms in the system, and or accumulation of somatic mutations. So what happens as a result of that? The cellular dysfunction and senescence takes place, increased risk of cancer development and accelerated aging phenotypes. So these mechanisms are the ones which are very important. The DNA damage, that is the double-stranded breaks, impaired DNA repair mechanisms, and accumulation of somatic mutations. So individuals with these defective processes often exhibit the premature aging phenotypes, and there is, and hence this gene, there's a critical role of this genome instability. So these mechanisms, like for example DNA double strand breaks, it is well studied in biochemistry. So these are the most deleterious form of DNA damage, acting as a major contributor of genome instability and the aging process. So this, there is simultaneous break in both the DNA strands, and it poses significant threat to the stability of the genome. And this is caused by, again, endogenous factors like any metabolic byproducts, replication errors, or as well as exogenous sources like radiation and chemicals. And there, in cases inefficient repair mechanisms to join these breaks, because there could be non-homologous end-joining repairs or homologous kind of repair mechanisms. But if these are not working properly, then there could be chromosomal rearrangements which can happen, mutations which can set in, and cellular senescence which drives the age-related pathology. So all these things can again result in aging process. And again, impaired DNA repair mechanisms. The cells have a lot of repair mechanisms. We again study these in biochemistry, that is base excision repair, nucleotide excision repair, homolog repair, and non-homologous end joining repair. So these are all which are to be active in the cells in case of any kind of damage or any process which has made these repair mechanisms incapable, then there will be result in the aging process. So understanding these mechanisms behind the decline is crucial for development of interventions, because if you understand what is the actual process which is happening in this particular individual, then probably that can be handled, and or these processes, defective processes, can be managed better, and this leads to something which is we always call as precision medicine. Okay, so that's a reason why the actual mechanism of why these how these processes happen in the body is required. So again, accumulation of somatic mutations. This is again changes which happen in the DNA of a somatic cell. These changes are not transmitted to the next generation, but still the somatic cell which accumulates this kind of mutations, they might get cancerous, and then they can go through the process of autophagy, and these cells die, and when their cells are not able to repair and do the proper function, again that process of aging happens. So the integrity of our somatic genome is constantly challenged, and the failure to maintain it efficiently contributes significantly to the aging phenotype. So all these processes are something which is important. So the next one, next to genome instability, is a telomere attrition, which ma'am has very well shown with the diagram. So this is again, the telomeres are the ones which are present at the ends of our chromosome. It protects our DNA from damage, but in every cell division, this the length of the telomere is decreased, and once the entire telomere length is decreased, these chromosomes or the DNA are prone for damage, and that's how the cells undergo the aging process. So the shortened telomeres are strongly linked to various age associated diseases and predict a reduced health span or the lifespan. So research on maintaining the tumor length is crucial for mitigating age-related decline. So there are a lot of studies going on to see how we can maintain the telomere length. So there are the telomerase enzyme which takes part in shortening of the telomere. If at all we increase the expression of this telomerase enzyme, whether the shortening of the telomere can be prevented. So these kind of studies are going on, which again are important to handle the aging process. So next, epigenetic alterations. We know what is epigenetics. It is the changes which not in the DNA sequence as such, but there are certain groups which are added or deleted from the DNA molecule. It could be methyl group, acetyl group, or some histone modifications. So these are the ones which cause changes in the gene expression. Okay, so they are they don't have any change in a DNA sequence as such, but they cause changes in the gene expression by modulating the way that RNA polymerase binds to the DNA. Okay, so the changes in the DNA methylation pattern can lead to altered gene expression, silencing or activating the genes inappropriately. And for example, even histone modifications, this histone modifications, again, they are the histones are the proteins wherein the DNA is wound around this histone proteins, and how tightly or how loosely this DNA is bound to the histones, that will indicate how much of the genes are expressed or how much of the genes are suppressed. And chromatin remodeling is also another epigenetic mechanism. So restructuring of the chromatin, that's a complex of DNA and proteins. They influence the gene activity and contributes to the age-related processes. So these epigenetic changes are not random. specific DNA methylation patterns usually are used to create this epigenetic clock, which was mentioned by ma'am also, and they can accurately predict the individual's biological age. And critically, because of these epigenetic modifications are potentially reversible, that is, you can remove the group or add the group, so it is a reversible mechanisms. They represent an attractive therapeutic target for anti-aging interventions. So these epigenetic modifications are the ones which the researchers are more interested in, because these are the reversible mechanisms, and you can think of strategies which can reverse the epigenetic changes and prevent the aging process. So these DNA methylations, a lot of studies have been done earlier. Lot of DNA CpG islands in the DNA molecules, that is where the methyl groups are bound in large numbers. So those CpG islands have been recognized and in certain genes which are important in the aging process. So these impact the gene expression, as I told you earlier. It can either increase or decrease the gene expression, and they can help us predict the actual biological age of an individual. So understanding these methylation changes offer a promising path to reverse the aspects of aging. Again, histone modifications, these are the chemicals like, for example, acetylation and methylation on the histone molecules. They can alter the chromatin structure and change the way in which the gene is accessible for RNA polymerase to express the genes. Okay, so these modifications act as epigenetic code, influencing whether the genes can be turned on or off without changing how the DNA sequence would be at that region. So without changing anything in the DNA sequence, these addition or removal of these groups can alter the gene expression. So understanding how these modifications shift with age offer a promising avenue for therapeutic interventions targeting age-related disease. In lot of disease process, epigenetic modifications are studied in detail, even in cancer, even in cardiovascular disorders. So all these things are interesting areas for research in these days. So even chromatin remodeling, so it is ATP-dependent complex restructuring of the nucleosomes along the DNA molecules. So you have the DNA mound around this one forming nucleosomes. This makes specific DNA region more or less accessible to transcription. It's a way just that wherein the transcription can be increased and decreased. So if it is increased, then the gene is switched on. If it is decreased, then the gene is switched off. Okay, so all these will result in the mechanisms where it can be modulated by certain therapeutic targets and or lifestyle modifications, and this can reverse the aging process. So understanding these age related changes in this process often potential targets for therapies promoting a healthy aging. So these are some of the studies which have been carried out on the epigenetic modulation of the aging process. I mean, these are the pioneer studies. So later on I'll show some examples of recent studies which have been carried out in the aging process. Another one is a loss of proteostasis. This also has been touched upon, ma'am. That is the protein folding, how the protein folding happens, the accurate and timely folding of the newly synthesized protein into their functional three-dimensional structure is important. If this folding does not happen properly, again there is accumulation of these proteins, and that is what happens in Alzheimer's and the Parkinson's disease. So specialized molecular chaperones assist the correct protein folding, and if there is any kind of refolding or misfolding, it can result in denatured proteins. And autophagy, that is a crucial cellular recycling mechanism responsible for degrading and recycling of the damaged cells. They also, sometimes these proteins which are misfolded can get aggregated, and these cells may undergo this process of autophagy. And the ubiquitin proteasome system is something which is well known among all the biochemists. We know that proteins which are tagged for degradation will be tagged with ubiquitin if they are undergoing the process of degradation. So this with aging, there is a decline in the proteostasis efficiency leading to accumulation of misfolded and aggregated proteins. It's a hallmark of aging, directly linked to neurodegenerative diseases like Alzheimer's, Parkinson's, and Huntington's disease. So again, if this process is hampered, we can go through the aging process earlier. So this is how the protein folding, which is assisted by the chaperone system. If the process does not happen properly, there is autophagy which takes place and there is degradation of these cells. So again, mitochondria, this also was told by ma'am, which again is an important organelle which plays an important role in the aging process. So declining efficiency in the electron transport chain leads to reduced ATP production, resulting in depletion of the cellular energy. And dysfunctional mitochondria generate more ROS, causing oxidative stress and cellular damage. And this, whenever there is ROS, more of ROS present inside the mitochondrial DNA can be, they get exposed to this ROS and the mutations happen in the mitochondrial DNA. And like in case of the nuclear DNA, these mitochondrial DNA do not have the repair mechanisms. So these mutations will remain in the mitochondrial DNA. So oxidative stress, cellular damage, and metabolic dysregulation is commonly seen in whenever the mitochondrial DNA is damaged. So these intertwined consequences underpin the mitochondrial theory of aging, which proposes mitochondrial dysfunction as again a key driving agent for aging. So these are all the different theories in the mitochondria. It is increased ROS production, oxidative stress and damage, mitochondrial damage, and accelerated cellular aging. These are the important mechanisms talked about when we are talking about mitochondrial aging. So cellular senescence, again, we have seen since morning, that is again accumulation of, while talking about the molecular end, I would tell about the DNA damage, telomere shortening, oncogenic stress. So these kind of, result in senescent cells, irreversible halt and division, and crucial mechanisms to prevent the propagation of the damaged cell. So ma'am also has talked about senescence associated secretory phenotype. So this is again important during the aging process. So it's a complex mix of pro-inflammatory cytokines, chemokines, growth factors, and proteases involved in that process. So this again, I won't talk about much about this. Stem cell exhaustion is also something, an important mechanism. Here, the declining the total number of the functional stem cells in various tissues. This happens as the process of aging. There's a decrease in the number of stem cells in every tissue. So even the existing stem cells exhibit impaired self-renewal and differentiation potential. So the body's ability to heal injuries and replace the damaged cells is severely compromised. And this exhaustion contributes to the progression of age-related conditions like sarcopenia and osteoporosis. So understanding and targeting the stem cell exhaustion is again a key to combat many of this age-related decline and diseases. So how we can work upon maintaining the stem cell population. So what are the different strategies which can be incorporated for maintaining the stem cell population? So these kind of research can be carried out so that the stem cell population can be maintained. So there is all these mechanisms, several of them are there, some things which we know, some things which we're not aware of yet. But on the whole, there is altered intracellular communication. So there is entire network. All these things in the entire network should be functioning properly. If any of the part of the network does not function properly, then of course there would be a aging process which will set in. So this age disrupts the intricate cellular communication networks affecting every tissue and organ function. So the chronic inflammation is one of the things which is usually seen because, the senescent cells will release the inflammatory markers which were shown in ma'am's figures. And this hormonal dysregulation also, imbalance of the hormone levels, affect key body processes like metabolism, growth, stress response, compromising most of the systemic homeostasis, and immune system decline, that is weakening immune surveillance. Our immune system actually has to be very strong and it should act as a soldier for us. If that capacity goes on decreasing, then there is setting of infection, cancer, reducing ability of the body to clear the damaged cells. Okay, so elevated inflammatory cytokines are the hallmark of inflammaging, subsequently contributing to age-related frailty and chronic disorders. So systems biology of aging, so you can see several mechanisms. It's either mitochondrial dysfunction, reactive oxygen species, DNA damage. So all these molecular are the molecular hallmarks of aging, and they do not operate in isolation. Instead, they form a intricate interdependent network where each pathway is dependent on the other. And there can be, if one pathway is affected, it can also affect the other pathways. So this understanding highlights aging not as a collection of isolated events, but as a complex biological network, making it challenging yet a promising target for multifaceted interventions. So there are a lot of strategies or a lot of pathways which can be targeted to prevent the aging process. So all these can act as biomarkers for aging. It could be the genomic markers, epigenetic markers, inflammatory markers, metabolic signatures, proteomic markers. So there's, as told by ma'am, it's a multi-omics approach. Each layer of the biological system can be targeted for biomarkers. So some of the studies which have been done wherein they have got good results with all these biomarkers. For example, telomere length as a biomarker. There have been recent studies which have been done and published in good journals where shortening of a telomere length was significantly associated with cardiovascular mortality. And there was another study which showed that 19% higher risk of sudden cardiac death was seen when there is shortening of the telomere. And genetically shortened telomeres are causally linked to increased risk of coronary artery disease and heart failure. So these are some of the interesting findings which actually make it meaningful when we are talking about the molecular decoding. And again, some studies on DNA methylation and aging where there were certain methylation markers which had high accuracy for mammalian tissue aging, and age deviations correlated with the human mortality risk and the calorie restriction. So this is also one study which is recently published, and another study where they identified a robust age index based on polycomb repressive complex 2 target sites and demonstrated sensitivity to both aging and regeneration interventions. And then there were some studies on inflammatory markers where elevated IL-6 and CRP significantly associated with frailty and accelerated biological aging, and these inflammatory markers predicted the functioning decline which was independent of chronological aging. And another one where IL-6 and CRP again strongly correlated with the biological age scorings. So these are some of the examples of studies. Metabolomic signatures also, wherein some branch chain amino acids correlated well with increased insulin resistance and metabolic dysfunction. And there was another study where acyl carnitine patterns predicted adverse cardiovascular events. So all these are kind of valuable biomarkers for assessing the biological age, and then maybe anti-aging interventions can be planned. So this is proteomic markers where GDF15 and beta-2 microglobulins indicate the biological aging and disease risk. So this also showed good correlation with mortality of cardiovascular diseases and other age-related conditions. So interventions targeting this aging mechanisms, what can we do about the aging mechanisms? So healthy aging involves lifestyle adjustments, and there are some pharmacological interventions which we saw in the previous talks also. So lifestyle interventions, of course, caloric restriction, exercise was stressed upon in the morning talk. And some of the pharmacological agents are also there which can, shown some good results with the aging process, but we need probably more validated studies on this one. And emerging therapies in aging research, there is some supplements like mononucleotide there's NMN and NR, which increases the NAD levels, and this is critical for energy metabolism and DNA repair. So declining of NAD plus with age is a key driver of metabolic dysfunction. So there are certain drugs which can boost this NAD, and mitochondrial targeted therapies can be researched upon. So these interventions aim at enhancing the mitochondrial function, reducing the oxidative stress, and directly addressing the mitochondrial theory of aging. And there's the epigenetic reprogramming techniques like Yamanaka factors. There's 4 Yamanaka factors which are identified, and these have shown to reverse the age-related epigenetic changes, potentially restoring the youthfulness and of the cellular states and function. So these are some of the researches which have shown positive results, motivating the people to work more on this area. So on the whole, all these things, genomics, proteomics, metabolomics, and now the artificial intelligence, because we will not be able to handle this big data without the help of artificial intelligence. So with this, the key take-home messages, that is, aging is not one process, it is interconnected mechanisms. It's a complex interplay of various molecular mechanisms, not an isolated process. So specific hallmarks like genomic instability, mitochondrial dysfunction, cellular senescence drive biological aging, and biomarkers and multi-omics technologies are revolutionizing our understanding and measurement of aging, and focusing on these pathways offer promising avenues for preventing diseases and extending a healthy lifespan. So thank you for your patient listening. So every cell in our body is aging right now, but understanding why this happens and how we can take the first step in changing the process is something which is important now, so that we can halt or reverse the aging process. Whether this is a reality, we should see as time comes. Thank you.
We have just witnessed an insightful and very engaging session. Thank you, ma'am. And the session is open for discussion. If you have any doubts, you can ask. I repeat, the session is open for discussion. Anyone in the back, if you want, I can pass my mic. No doubts? Yes.
So in talking about pharmacological drugs, they talk about rapamycin. So what is the status now, madam? Rapamycin.
I have not checked what the status of this is, but I think the previous speakers also had shown that drug in their presentation. But yeah, I'm not sure if there has been any clinical trial on that. Need to check on that.
Any established allopathy, so far no drugs are there?
No. I don't think any of the drugs have come to the clinical trial with respect to aging. Okay. Yeah, because you need a lot of preclinical validation for it to come to clinical trials.
Thank you so much, ma'am.
Anyone else?
Madam, as you said, we know the chronological age, but
dietitians, everyone, celebrity dietitians, whatever, they talk about the biological age as well as there is a calculator. They calculate, and many a times even I have tried, is there any defined calculator for that? Because we have something to calculate the insulin resistance. We have something to calculate insulin sensitivity.
As of now, there is only that epigenetic clock which is there, but that again we cannot use that for everyone, because trying to find the methylation status at every gene level would be difficult as of now. It was done only for the research study in one of the studies. After that, we have not seen any results with that. Okay, but yeah, celebrities, they take a lot of the hormones, which is something which is known. That is one thing which they take, but I don't know whether they are taking any kind of anti-aging pills or something like that, whether that is available in the market, because it might have a lot of side effects if we are taking it without proper clinical trial on that.
They are charging lakhs of rupees for the consultation,
Yes.
madam, and they are giving that the biological, they themselves actually, expound very well that I am actually 53 years old, but my biological age is 14. They give advertisement like that, and they attract people, and they are also ready to sponsor, spend money there.
Oh, okay.
So far I haven't got any calculator like that, but because when I went through the internet, I don't think, I was very much, I was confused whether some calculator is accessible only for the higher cadre people, or there is any
No,
calculator
I don't
available
think,
for
because
everyone.
if it is there, then it should have been published with publications and then clinical trials. Only we can believe this. At least being in the scientific community, maybe we shouldn't get carried over by those advertisements without any proper scientific data.
Thank you.
Any more questions? Okay, with that, I am concluding the session. I am now invite.
Thank you. Ma'am, it was a wonderful session.
Thank you.
From my side, I just have one question for you. Is there any studies going on regarding stem cell therapy and aging?
No.
Have you come across something related
as
to
such,
it?
there is no studies going on stem cell therapy and aging because there's a lot of things like ethical concerns with this. And stem cells cannot be used by a normal person for any, if at all there is some kind of disorders, only then the stem cell therapies are given. But a normal person taking stem cell therapy just for reversing the aging has not been studied so far.
Okay.
Yeah, because ethical concerns come there.
Thank you. Thank you, ma'am. It was a wonderful session. It was a very informative and an elaborate session, decoding all the details of the molecular aspects of aging, and explaining clearly about the evolutionary theory, genomic instability concepts, and process of reversal of aging. And one sentence really catched my attention. Age is not just a disease, but it's an underlying process behind many diseases. So if you understand that, if you're going to modulate other things, you will look young. So just as a concluding remarks, I would say that this decoding aging at the molecular level is a key focus in medical biochemistry, and it clearly explains how this biochemical changes contribute to the functional decline. And aging is associated with various mechanisms like oxidative stress, accumulation of DNA damage, telomere shortening, mitochondrial dysfunction, and altered protein homeostasis, which was explained clearly by Madam, and it was given as a take-home message for you. So, and we also expect people to take up some topic as a research in your career and come up with many theories and many practical solutions for the process of aging. Thank you. Thank you, ma'am. It was a wonderful session.
I now invite Dr. Anandi ma'am and Dr. Marvin ma'am to felicitate the speaker and the chairperson. Well, everyone, with that, we are breaking this session for lunch. Lunch is arranged in the 5th floor of Biochemistry Laboratory. I repeat, the lunch is arranged in the 5th floor Biochemistry Laboratory. You can be back after 1 hour, and so that we can continue this session. Please be back after 1 hour so that we can continue this session. No, like last time, ma'am asked me to change to like.
Marvel,
yeah. That's it.
This time, who's felicitating for this last time?
Yes, no, I will ask. During the session, I will ask. Whoever is available here, ma'am will share. It's actually Guru Bhavan, sir.
Yeah, because both are mostly Kedai means also they are not. So let's see. I'll ask her before this. And then answer is the answer. We just ask them to searching for comment section.
I can't see because it's I saw it last time, that's why.
This thing, once you're finished setting, I'll come and take the. Had lunch?
Welcome back everyone. Hope you had enjoyed your lunch, and now we are continuing to the last session. And yeah, and which covers one of the fascinating aspects of science actually. We have with us Dr. Ravi, who will be presenting on the topic gastrointestinal tract in aging, the primary route to health and longevity. To formally invite the chairperson to the dais and commence the proceedings, I now request Mr. Harish to come forward.
Good afternoon to everyone. I am Sri Harish, final year postgraduate student from the Department of Biochemistry. It's my great pleasure to introduce our respected moderator for this session, Dr. R. Kannan sir. Sir is currently working as the professor and head of the Department of General Medicine and also the vice principal at Saveetha Medical College. He completed his MBBS and MD from the Madurai Medical College. He has also received many prestigious fellowships such as FICP, FRCP from Edinburgh, FACP from the USA, FIACM and FIAMS, which shows his excellence and recognition in the field of medicine. He has many years of experience in teaching and clinical practice. Sir has published more than 150 research articles in national and international journals. He has also served as the principal investigator in 12 clinical trials, contributing greatly to medical research. In addition, he has received 28 awards at both national and international levels. One of his notable achievements is receiving the Excellent Service Silver Award from the Government of Singapore. We are truly honored to have such an experienced and respected academician and clinician with us today. I now invite Dr. Kannan sir kindly come onto the stage and moderate the session. Thank you, sir.
So good afternoon. Thank you. I will introduce, I am very happy and honored to introduce Dr. Ravi sir. He is a clinical lead in the Department of Gastroenterology, Liver Disease and Endoscopy in Apollo Specialty Hospital. I was talking with sir, and sir is a very senior and experienced person in the field of gastroenterology. And currently, sir is the president of Indian Society of Gastroenterology Tamil Nadu chapter, and he is the secretary of Society of Gastroenterology of Tamil Nadu chapter. He is also a governing council member of Society of Gastroenterology of India. He has got many publications in both international and national journals, and sir is a teacher of many of the postgraduates in gastroenterology field. And his clinical interest is ERCP, endoscopic ultrasound, and other GI intervention endoscopy procedures. We are very happy to have you as a speaker in our conference, sir. Over to you, sir.
Good afternoon, everybody. Thank you, Dr. Kannan, for introducing me. So, this is the second time I'm coming to this college. I don't know whether I have done a procedure here. I think maybe I did a ERCP some many years back in this hospital. And so Dr. Anandi called me and said, you need to deliver a lecture. I know it's a biochemistry. I was worried. Biochemistry is I think it's the only department in my undergraduate time. I don't remember who is the professor and assistant professor. We know who headed the physiology, biochemistry, physiology and anatomy, but still I don't remember anybody from biochemistry. And in fact, all of us are very weak in biochemistry. In fact, one of the very favorite, my question I ask students is, which organ produces urea? Almost 50% of the students tell, or even consultant tell, it is produced in the kidney. So that is our knowledge. It took me a long time to understand it is produced, it is part of a liver function. So, but then Dr. Anandi called me, so I can't refuse. My own sister's name is Anandi, so I know when you said Anandi, I remembered. I was wondering, the voice is different, the name is same, who is this? Then she told me. And another similarity is I also studied in SMC, not this SMC, Stanley Medical College, that is also called SMC. So how do I move the slide? Here. So, okay. Here. This is also not working. So, so nowadays pediatricians, pediatricians start, they are treating 22-year-old persons also, because there is a continuity. And I asked one of the pediatricians, So now the patient is more than 20 years. So why are you treating? He says anybody who is brought by their parent is a pediatric patient. So now elderly, if they come alone, it's okay. If alone, even if they come at 60, 65 years, 70 years, they are not elderly. So even if they are young and brought by children, they should be considered elderly. It used to be, I thought when I was 50 years old, 40 years, I thought maybe around 60 will be old. Now I am 67. I want to think that 80 is only elderly and below that still young. I never, that age number never came to me for a long time. In fact, even as late as 5 years back, I used to get up when even 40-year-old person come into my room, thinking that he is elder than me. Nowadays, very consciously, now you are old. You shouldn't give so much respect to a person who is 40 years. So I hold myself to the chair and sit. So, but nowadays I'm thinking I'm getting older, but the things I do are not many days, it's not compatible with old age. I'll show you some of the slides. So there is a book on healthy aging. I think it's similar to that. And people were asked, what do you want to do when you become old? So when you become 70 years, when you become 80 years, what do you? So a lot of people said hike 1.5 miles on a hilly trail, get up off the floor under your own power using a maximum of 1 arm per support, pick up a young child from floor. Like that, there are several things. So we should maintain such healthiness. Everybody, if you're lucky, if you become old, or if you leave to become old, you're lucky. So I'm one of those lucky person. I don't think that death is sooner coming to me. I will live long. So if you ask a gastroenterology part, what do you want most of our patients? Eat 2 idlis at least twice a day or once a day, and shit at least once a day. If that is happening to a person, his GI tract is healthy. So today's current current political scenario, shit is not a bad word. It is very pious word. Even many top presidents speak in those terms only. So otherwise, we wouldn't use those words in classes. So I'll go from top. So as we go older, there is a decreased salivary secretion. And there is a change in taste perception because of fewer taste receptors. But then saliva is a very, very important part of our digestive system. In fact, many of the bariatric surgeons think it is because we are not chewing food adequately, many of us become obese. So it is very important. Saliva helps one in starting the digestion in the mouth only, and then only if you mix the food with the saliva, you can feel the taste. So taste is felt only because the food gets mixed with saliva, and also it helps in swallowing. It lubricates the esophagus, so swallowing becomes easier. But as we grow older, all this secretions become very dry due to many reasons. One, age-related reduction, and many of the older people are on multiple medications. And swallowing itself is it's a combination of neuromuscular function, and a lot of older people have cerebral atrophy, multiple cerebral small infarct, and a lot of CNS changes. Because of that, there is a problem with swallowing food. So such problem is called transfer dysphagia. You are not able to transfer the food from the oral cavity into the esophagus. It is called transfer dysphagia. It is not because of any obstruction. So many older people have such function, such dysfunction. So heartburn. Again, heartburn is one of the very, very commonest symptom. If not an adult, it is so common in young people. It is very, very expensive disease also. Many of us are on proton pump inhibitors and the recent potassium competitive acid blockers for donkey's years, and it reduces the quality of life. Predominantly these heartburn happens in the night, so your sleep is disturbed. Because sleep is disturbed, even next days your work schedules are disturbed. And many of us have occasionally has heartburn, but older people have very often heartburn, and that is because their lower esophageal sphincter between the esophagus and stomach, the pressure in that become reduced. Sometimes even the stomach moves up because the hiatus opening become bigger. So as a result of this, there is a reflux of acid. And this happens, if it happens in the daytime, we realize it, we swallow saliva, we drink water, we neutralize the acid and push it back. But if it happens in the night, the gravity is not there and you don't get up to neutralize the acid, and then you're unaware this is happening because you're sleeping also. So if it remains for a long time, it causes a lot of problem. Older people nowadays are very obese also. Their diet, they're eating. At least there is a misconception that there is a misconception among population itself that acid is secreted as per duration of time, and then we need to eat to dilute it. It is not like that. Acid is, we have studied our physiology, we have studied that acid will be secreted only if you eat. You don't eat to dilute the acid. So because nowadays people sit at home, there is something always available on the table, available in the fridge, they don't go to work also, they keep eating many times. So every time you eat, acid is secreted. The longer the acid secrete, it comes up, and even older people has hiatal hernia. So if it is remaining for a long time, they develop changes in the lower esophagus. The lower esophagus, which is normally covered by squamous epithelium, become columnar epithelium. That we call it as metaplasia, Barrett's metaplasia, intestinal metaplasia. And if they have it for a long time, they develop cancer in the lower esophagus and GE junction, and GE junction growth is the most rapidly increasing incidence of growth in whole GI cancers. So in fact, American College of Gastroenterology advises regular screening. So if it remains long time, if there is a difficulty swallowing, this one symptom, old age, we are pretty sure if 100 people come with this symptom, 90 will be because of esophageal carcinoma. Anybody difficulty swallowing, it is considered as cancer until otherwise proved. It increases with age, and early signs are very subtle, and swallowing difficulty is a late symptom. In fact, if somebody has a dysphagia and come with esophageal carcinoma, we say it is beginning of a end. But currently there are very good treatment available, even diagnostic methods are available. So this symptom should be taken very seriously. So next, I think I will move to stomach. So if you take older people, but one more thing, so even though I say esophageal carcinomas are common in old people, now of late people become very elderly in young age only. We are seeing cricopharyngeal carcinoma, esophageal carcinoma, gastric carcinoma very early in their life, 30 years, 35 years coming with cancer. So currently because of food and lifestyle, maybe I believe that it is because of food. People are becoming elder much earlier than people who lived in my time. So we will, if there is a question, we'll discuss that later. So there is an increased risk of UGI bleeding because many of them are on NSAID for pain because of arthritis, muscle pain, so many pain. And they develop chronic atrophic gastritis and hypochlorhydria. Because of that, it impairs with the absorption of minerals, vitamins, and drug absorption. So they behave differently. And if they have a bleeding, and it is very difficult to manage, they don't tolerate bigger bleeding, and we find it difficult to resuscitate them, and they will have, even surgery will be difficult in them. They don't tolerate major surgery. It's not moving. Yeah. So it's common in older adult, and because they have chronic H. pylori infections, and it's highest in older adults in developed countries. In our country, all ages have H. pylori, and they are on different drugs: aspirin, alcohol, corticosteroid, NSAID, and this PPI. Many of them are all, because they are on NSAID, they take PPI also. PPI, proton pump inhibitor, they suppress acid secretion. We thought it is quite innocuous drug, not much side effect. We are increasingly realizing there are many side effects associated with PPI, like Clostridium difficile colitis, community acquired pneumonia, diarrheas. If acid is a very important liquid, it is required for helping digestion as well as killing the bacteria we swallow, but then we are suppressing it for a long time, and they are very prone for GI infection, osteoporosis. Some of them develop, chronic users develop fractures. So small intestine, so we can, in fact, our endoscopy can come above and we can go from below, and most of the esophagus, stomach, and up to probably, usually normally we see up to D2, papilla. And sometime when we really want, we can go up to the DJ junction, duodenojejunal junction. And below we can see the whole large intestine and enter through the ileocecal valve into about 10-20 centimeter of ileum. But rest of the small bowel is, it is invisible to endoscopy. But of course we have capsule endoscopy, which when we swallow can transmit pictures outside. But small intestine is the only organ which is absolutely required for digestion. You can live without stomach, you can live without colon, and esophagus only transfers the food from out to the stomach. But small intestine is the only one which is very, very important. It digests food, it absorbs food. You need to have at least 400 centimeter of small bowel, and most of the digestive function happens in small bowel, and of course aided by the bile secreted by the liver and the enzyme which comes from the pancreas. There are several issues as we age: mortality, likely related to medication, psychiatry medications, neurology medication, and even the villi becomes slightly dwarf, So resulting in reduced surface area for absorption. Secretion, we don't know whether it is reduced. There are some ischemic changes in patients who have other diseases of the other organ. Celiac disease is on the rise in older disease. Celiac disease is a disease which is patients develop villous atrophy due to gluten exposure, which is common in wheat. So, and many of them have some abnormal studies. When you investigate them for something, they will have some pancreatic cyst. They will have a small tumor in the intestine. Sometimes we can find a leiomyoma in the esophagus, just in stomachs, lipoma. But then, because we find them incidentally, we subject them for unnecessary test and treatment. So we should be aware, and many of the vascular lesions, for example, angiodysplasias, angioectasia in colon, they are all very common in old people. They may not be symptomatic. Only way when they become symptomatic, they need. Usually, small intestine is a very sterile place. Stomach is a sterile place. Proximal duodenum is a sterile place. Small intestine is sterile. It is not that there are a lot of acid. The whole world is talking about those bacteria only. So again, large intestine, God has created, if you believe in God, all the blood which is going to the limb, they return directly to the liver, to the heart. Whereas small intestinal blood and the intestinal veins, they drain into the liver. So through that, the nutrients pass on information, the bacteria pass on information. In fact, the bacteria are considered today as a second brain. In fact, I prepared a talk in MMC for some lecture on GI bacteria. There used to be a statement that you are as good as the food you take. In fact, when I finished the talk, I told them you are as good as your stools. That is how today the world view the bacteria, and we need to take care of those bacteria. So how do we take care? Maybe I will tell you. So there are several bacteria, viruses, there are many other fungi, parasites, so many things are in the intestine. They have a balance. They had a balance between them. If one bad bacteria come, good bacteria will take care of that. That balance nowadays is lost. Because of that, we are seeing increasing number of certain disease. For example, inflammatory bowel disease. We never used to have inflammatory bowel disease when I was an undergraduate in not undergraduate, even as a postgraduate. DM postgraduate, in fact, we had a patient whom I said, I diagnosed it as Crohn's disease. It's one of the, ulcerative colitis and Crohn's disease are the two prototypical IBD, inflammatory bowel disease. And then I had a big beating from my professor in the back. I can feel the pain, such heavy beating I had. He said, no, Crohn's disease doesn't exist in India. Now we see every other week, we see a new Crohn's disease patient. It is because of our lifestyle. It is because of the electricity. You ask me what is it, I will tell you. And several bacteria, and they have a very balanced, and in fact, there are bacteria in all over the body. There are bacteria very specific for nasal cavity, oral bacteria. In fact, there is a very wide variety of bacteria in oral cavity. In fact, there are research going on what changes happens in the oral bacteria which results in caries, dental problems, all that. Now lot of research is going on. And like that, we get bacteria from the surroundings. If we are delivered through the vagina, it comes from the vagina. And then the surrounding, the way we fed, the people around us. So in fact, at least in many diseases, doctors have understood the value of bacteria. In fact, some of the diseases are treated by fecal transplantation. So they take feces from some of the healthy donors, usually their relatives, spouses, and then filter the bacteria and then give it as enema. Sooner they will find out a way how to give this orally also. In capsule form, we'll be eating fecal. We are already doing that. So gut dysbiosis, microbial imbalance resulting in visceral hyperalgesia, decreased pain inhibition, and diminished gut barrier function. Because of that, lot of chemical which are not supposed to go into circulation because of this dysbiosis, they go into the circulation and they cause us, in fact, cirrhosis, and in fact obesity. They think it is because the bacteria changes. Some people develop obesity. Such is the studies going on. And in fact, the number of bacteria in our body is more than the number of our own cells. So we are made of more bacteria than our own cells. Inflammatory bowel disease, it's a disease in which it is not an autoimmune disorder, at least for the undergraduate. We have mucosal system. It is one of the second largest mucosal lymphatic system is in the gut. So these lymphatic system recognize this bacteria as not as an enemy. They recognize them as commensal. They recognize that they are there in the gut for helping us, so they don't attack them. In inflammatory bowel disease, our dysregulated immune system, probably because of the food we take over many years, there is change in these perception, and our own immune system recognize this as pathogenic, and they fight in the gut. So that is what is inflammatory bowel disease. It is very, very increasingly common nowadays. It is increased in elderly people, and it is most pronounced. Of course, it is very severe when it happens in young children. This one disease which is more common because older people are on multiple antibiotics, they are sicker, and there are several comorbidity. They undergo surgery. Because of that, they are on different type of antibiotic, which reduces the good bacteria, making them susceptible to this Clostridium difficile enterocolitis. And again, constipation. It's one of the very, very common problem in old people. They sit all the time at home. At least people of my generation think every day you need to go to toilet. But the food has changed. We don't eat so much food nowadays. Our food quantity has decreased. Fiber has decreased. The energy has increased. The energy, about 1,000, 2,000 kilocalorie of energy is packed in as small as a gulab jamun. What is motion? Motion is 50% is the food which is not digested by us, and the bacteria. In fact, bacteria is almost 50% of the stool volume. So bacteria, we are already killing the bacteria. We are not feeding them, and we are not eating enough fiber. Even old people, same. And because of that, constipation has become a very, very high problem nowadays. There are several increasing number of drugs investigate, produced, introduced into the market. Many of the nursing home residents have prolonged transit time. It used to be less than 3 days. Nowadays, it takes 3 weeks. And it is because of age-related factors, chronic disease, immobility, medication, many of them Parkinsonism medication, psychiatry medication, they cause constipation. And epidemiological study, GI symptom, show that constipation and fecal incontinence were more prevalent than adults. Fecal incontinence is one of the underreported condition. So when once somebody become incontinent, they are glued to their home. Their whole life is then will be within the room only. Several other disorders are common. Risk of constipation because of decreased transit time, inactivity, low fiber, inadequate fluid intake, low exercise. Sometimes they can have an obstructive lesion, anxiety, depression, and 28% of older adults have fecal soiling sometime in their lifetime. And of course, functional GI complaint should be investigated, particularly in older people. Younger people, there are some ROM criteria for diagnosing functional, but older people needs investigation. Incontinence is involuntary leakage of stool or gas or motion from the rectum, range from fecal soiling to complete loss of stool from rectum. And this is one of the very, very disabling symptoms. It causes depression, reduced quality of life, social isolation. They are stuck to home. You call them somewhere, they won't come, even to temple. And can be because of several, and many, they are on multiple drugs. There are several drugs which cause anti-diabetic drug, anti-hypertensive drug causes diarrhea. Many drugs cause diarrhea, and sometimes they are put on diarrheal drugs by the clinician, so they can also cause diarrhea. And colorectal is one of the very common cancer nowadays. It is very much decreased in Western world because of regular screening for colon cancer. It hasn't caught up in India. We are trying to start it, but of course there are difficulty in delivering services to such a large number of population and the expenses involved in it. But of course there is a test called fecal immunochemical test. It is slightly different from stool occult blood. Stool occult blood will recognize bleeding from any side. A fecal immunochemical test will recognize only the blood which is coming from the lower GI tract. If anybody tests positive, then they need to undergo colonoscopy. And in fact, these are all diseases of the cancer, diseases of the elderly. And in fact, it is so common in young elderly people. We can call them young elderly. They become elderly at 45. Now, American Society has recommended colonoscopy after age 45. It used to be 60, 55, now it is 45. So, this risk are increased in hereditary polyposis, IBD, certain race, people who are on non-veg, lot of red meats, obese people, diverticulosis, another disease in which there is a sac-like protrusion of the mucosa out of the colonic wall. This is one of the very common, almost 50-60% of patients older than 70 years have this. Many of them are asymptomatic, some of them come with bleeding, diverticulitis, perforation, peritonitis. So they all need proper examination. So healthy aging is what? I used to read a book called Ikigai. Ikigai is a Japanese word meant for having a purpose in life. So everybody, whatever age we are in, we should have a purpose. We should exercise more. So in fact, I started following this for the last 6-7 years. Every day I do my exercise from morning 5 to 6:30. Only today I haven't gone because I thought I have to finally arrange the slides. Otherwise, by the time I finish, my wife gets up, I would have finished my exercise and returned home and eat less. So this is very important. In fact, I believe food is the cause for all the disease. It is not genetics. It is not genetics. Genes are modified. Genes behave differently when we eat unnecessary things. So nowadays I ask people to eat less. So sleep well, at least 6-7 hours a day. Sleep early, and most important is have friends. I want to stress a little bit on diet. More fiber, less calorie. This is very, very important because all of us eat, whatever we eat, whether it is protein, sugar, fat, all of them are stored as fat only. Fat is one of the very important structure which causes diabetes, which is the cause for diabetes, which is the reason for insulin resistance. Eat more protein, eat less often. So this I stress to everybody, I follow that. So everybody should have a fasting period of a minimum of 14 years, which is very, very mandatory. And that is how we used to eat in our days when we were children. We don't get food after 6 p.m. because after 6 p.m. in my village there is no electricity. Electricity was there, but then the voltage is so low you can't see anything. So all elderly women, they close the kitchen after 6. They need to feed us at 5:30, and then clean the dishes. There is no fridge to keep remnant food. So everything is closed. And then morning they had to cook. So automatically we were doing 14 hours fasting. Nowadays we eat very late, 10 o'clock, 12 o'clock. And the body repair itself during fasting time. It has a function of autophagy. It removes the defective mitochondria. Everything is done during fasting time. But then our stomach has food 24 hours. So that is why these cancers are coming. So mandatory fasting. So most of my working days I eat only once. In spite of finishing 10,000 steps in the morning, I have my only food around 4 o'clock. Other than that, I have two coffees. So today I finished my dinner also here. Avoid processed food. Skip at least one meal. Skipping is very good. Both physical skipping and skipping a meal. Finish dinner early before 6 o'clock. Once in a while it is okay. You can eat whatever you want, sweets, everything, but do it once in a year. Once in a month. So, and if you want to feel young, this is my wife. She is 10 years younger. So whenever I am with her, I feel 10 years younger. And this is a boy who know me since he was a child. And I'm always surrounded by people like this only. If you, whoever comes, even best, beautiful, pretty girlfriend comes, if I am there, he will come with me only. If I call him, he will dish them and come with me. And he's doing an MS in Balaji Medical College. And this is how, this is one of those Women's Day we celebrated. Whatever my photo, very difficult to find older people along with me. Only during my classmates group meeting you can see people of my age. Otherwise, I party with young people. So, thank you. This is one of those, my birthday. Nobody will be of my age. Thank you, thank you. And in fact, one more slide. Next slide. So in fact, we went for a trekking. This is about 2 years back. I'm about 65. They were reluctant to take me. And all the other guys are younger. And in fact, I came first. I never complained, never stopped anywhere. About 9 kilometers of trekking in hilly area, I finished first. I don't have any problem. Thank you, thanks for patient hearing.
What a thought-provoking, enriching and energetic speech that was. And thank you so much for sharing your perspectives on the topic, and the ideas presented today will certainly help us in giving an edge in applying and in respective fields of the studies. And one of the questions was asked from the online session, sir. I will read it out. How to follow up a case of 45 years male with hiatus hernia with H. pylori strongly positive, treated by medical gastroenterologist. I will repeat the question. A case of 44 years male with hiatus hernia with H. pylori strongly positive, treated by medical gastroenterologist.
So, of course, H. pylori is a different disease, hiatus is different. H. pylori, today we are increasingly aware, H. pylori chronic infection causes chronic inflammation of the stomach, resulting in CA stomach as well as GI lymphoma, gastric lymphoma. So H. pylori should be treated. It is treated with antibiotic, 4 drug therapy, 2 antibiotic, 1 PPI, and in addition to that, some people use bismuth. So it should be treated for 2 weeks, and then maybe after a year you can recheck whether this has gone off. Hiatus hernia is a different disease where the esophagus goes into the abdominal cavity through a small opening in the diaphragm, which is called hiatus. It tightly hugs the esophagus. It prevents reflux of acid. So if just the presence of hiatus is not an indication for anything. If it is a very large hiatus causing recurrent reflux, esophageal and extraesophageal symptom, they need surgery. They need correction by surgery. There is no medicine for it. If it is in elderly people, then we don't advise surgery. The best way is to raise the head end of bed. Not the head alone, with a pillow. The whole bed should be slanting so that while sleeping they maintain a gravity, acid doesn't come up. Even if acid comes up, it goes down. That is how it is managed. Young people surgery, elderly conservative, H. pylori antibiotic.
Now the session is open for discussion.
I'm a clinician, I'm not a biochemist.
Hi sir, great to see you sir after a long time. Actually when I started my work in gastroenteritis in my CSA project, I had referred your works, and also for the gut microbiome studies in IBD in CMC. So it's thank you for the organizers. Today I met you in person, sir. So I have a question, sir. There is 3 things were there. One was the hyperulcer colitis, and second one was the genetic profiling, and third one was the cancer profiling. Is there any cross-linkings between these 3, sir?
What did you ask? Again, ask me again.
Yes, sir. So, as we all know,
genetic profiling.
Yes, in the IBD profiling as well as in the microbiome profilings, there are 2 conditions were happening. No? So, hyperulcerative colitis conditions were there, and genetic profilings were there, and the other thing was the cancer profilings. Is there any cross-linkings between these conditions, which leads to stomach cancer, something like that?
So all of them are connected. In fact, There are doctors, there is very great amount of work which attribute even colon cancer to infection. At least one the related cancer, for example, hepatitis B, it causes cancer through cirrhosis, but it can also cause cancer without cirrhosis. There are many other cancers which can be caused by infection. In fact, one of the typical cancer, gastric lymphoma, it is a mucosal lymphoma. We call it as, what do you call it as? So gastric low-grade lymphoma are treated with antibiotic. If you treat H. pylori, the lymphoma goes away. So like that, colon also, typically ulcerative colitis, how is it defined? It is a chronic inflammation in the colon due to dysregulated immune system in a genetically prone person and due to some environmental reason. So if you say so many reasons, then it becomes idiopathic. Do you know what is the meaning of idiopathic? Any idiopathic means the patient is very pathetic. Very pathetic. That is why it is idiopathic. And where is the idiom? Doctor is idiotic. So doctor is idiotic, patient is pathetic. That is so if you give so many reasons, then of course cancer will come in any chronic inflammation, whether it is and IBD is a condition where there is a chronic inflammation, so they are prone for cancer, particularly people who have less control during therapy, they develop cancer. And many of the genes, they get, I think genes, the genes are common for our grandparents and us, but and the gene will be same for the nail and hair and the mucosa. But each place it exhibit certain characters. They are made to exhibit certain characters. So at least in chronic inflammation because of our diet and so many other things, the tumor suppressor genes don't express themselves, and the other genes, it is not genetics, it is something else which causes cancer. And in fact, if it happens in the family, they have shared the same food and lifestyle. It is more because of food and lifestyle than genetic. That is what it is called, epigenetics.
Epigenetics, yes sir. Yeah.
I think a lot of people don't agree with me. I'm very madly propagating it is food and in fact I tell patients for growing a plant, what do you need? You need some liquid, which is water. You need manure.
Yes sir.
For a hospital to grow, what do you need? You need what manure? Sweets as manure and oil as liquid. If you put both, hospital will grow.
Thank you so much, sir. Obviously, it's our food habits which makes us our health to be healthy or unhealthy, sir.
I said electricity is the cause. So because of electricity, we are awake longer. We are awake up to 10, 11, and food is available. In our time, we can't see food beyond 6 o'clock. You won't know whether there is an insect in it. So every food activities are closed beyond 5 o'clock, 6 o'clock. And only food available after 6 is banana. Nothing else. I mean, as a child, I never got apple also.
To improve the digestion, sir.
Huh?
To improve the digestion process.
Digestion process.
No, sir. To eat banana to improvise our digestion
No.
process. Is it
Banana
like that,
is
sir? It's not like
banana
that.
doesn't improve.
Because many people
it is
actually
a dangerous
doing that.
one. It is full of calories only.
Yeah. Thank you so much, sir. Thank you for
thank
your
you.
answer.
Any more doubts? Okay, with that, now I am inviting Dr. Kannan sir and Dr. Guripavan sir and Dr. Suripriya ma'am to facilitate the speaker.